from the audience following each presentation and kindly request everyone to maintain decorum throughout the session. I invite Dr. E.V.S. Subramaniam, Professor of Srinivas College of Pharmacy, Vice President, to initiate the proceedings.
Good morning to you all. Today, I am extremely pleased to welcome the delegates who have come from faraway places also to participate, witness and contribute in the proceedings of this two-day national conference. Innovative practices in clinical training and patient safety. I am very proud to tell you this conference, that is 7th in its series, has been organized by the Srinivas College of Pharmacy in association with the Indian Pharmaceutical Association local branch Bangalore, with the assistance from RAJIV University of Health Sciences, Karnataka, Bangalore. As a professional ritual every year, and we have reached the 7th year. Every year we are taking the professionally qualitative steps to improve the quality and quantity of the proceedings, much to the interest, happiness of the participants. This year, especially the conference, though it is centric to pharmacy courses, the proceedings will acknowledge the spectrum has been widened to other branches also, because the even postgraduate students, pharmacy students, even undergraduate students were very much interested to participate in the proceedings of this conference. More than 500 and odd delegates have registered. This time, students, or rather participants, are participating even from the Tamil Nadu, far off places, Kerala and North Karnataka. Of course, from full participation from the Dakshin Kannada district also. This is a platform for the younger generation to know the updates and also innovations in clinical aspects. Keeping all these things in mind, the organizing team have invited the experienced professional speakers to deliberate their knowledge during the proceedings of the day. We have got very experienced professionals, healthcare professionals, and I hope all of you will immensely benefit from the proceedings of this conference. And this is a platform, an important platform, where you can present your skills in oral as well as poster sessions. And I do earnestly hope that your 2 days stay with active participation in the conference will make you happy and you will be returning with satisfied minds. Lastly, I will be failing in my duty if I do not disclose to you the main person who has been toiling hard, sparing no efforts, leaving no stone unturned to make all these 7 conferences highly successful. That is our principal, Dr. A. Ramakrishna Chabraya. He is the principal and director of this Srinivas College of Pharmacy. Of course, about him, our students, that is the students of Srinivas College of Pharmacy, are well aware. But I am very happy to introduce this gentleman to the people who have come from faraway places and other pharmacy institutions. Dr. Ramakrishna Chabraya is from this place and he is qualified from the diploma, B.Pharm, M.Pharm and PhD. Apart from that, he is also a postgraduate in management studies and also he has got a rich professional experience as a teacher of more than 2.5 decades, having guided more than 100 M.Pharm students, having published more than 150 research publications in national, international conferences. He is a member, life member of many professional bodies, and he is at a very young age. He has visited many foreign countries, contributed immensely with his lectures, chaired many scientific persons, and presented many original research publications. During this professional journey, he has visited France, Australia, USA, Turkey, Dubai, Malaysia, Sri Lanka, and Thailand, where he has also gone as an invited speaker on international platforms. With this small introduction, I am very happy that we have worked, this organizing team has worked under the able guidance of Dr. Chabraya to make this conference a grand success. And I acknowledge the presence of all the eminent speakers who have come all over here and all the experienced teachers who have come from other institutions and all the students who have come from all other institutions and our institutions, the services of the organizing team and everybody here who are gathered over here. I acknowledge their contributions. Thank you very much. I wish all of you will have a peaceful, happy, fruitful deliberations and purposeful stay. Thank you very much.
It is my honor to invite Dr. Jagadish Kamath, Principal of Sridevi College of Pharmacy, Mangalore, and Dr. Karunakar Hegde, Head of the Department and Professor of Srinivas College of Pharmacy, to chair this session. I also formally invite Dr. Keshava Pai, Professor and Head of the Department of Psychiatry, Kasturba Medical College, Mangalore. I request Ms. Dhanya, Assistant Professor of Srinivas College of Pharmacy, to welcome Dr. Jagadish V. Kamath with a bouquet of flowers. I request Ms. Pooja Gopal Pujari, Associate Professor of Srinivas College of Pharmacy.
Served as an external evaluator for institutions like IMANS. He has also participated in clinical trials, including a phase 4 study on major depressive disorder treatment. Dr. Pai has completed certifications from MC Master, Yale and Rice University in mindfulness, parenting and self-determination theory. ongoing research explores psychiatric interventions, mental well-being, and clinical psychopharmacology. The topic which has been given to him is very interesting. As pharmacists, we know the side effects of psychotropic drugs, mainly the habituation or addiction, then catalepsy type of mental disorders. So he is the right person to give a deliberation on this topic. On this special occasion, I invite him to deliver his presentations, and I thank the authorities, principal, as well as all the organizers for giving me opportunity to share my views. Thank you very much. I request the speaker to deliver his presentation. Thank you.
Good morning. Am I audible? At the outset, I would like to thank the organizers, Srinivas College of Pharmacy, for having called me here to exchange my views, my opinions about the psychotropics. So when I was called for this conference as a guest speaker, I was just thinking, what will be my role as a mental health? But it's not to minimize lots of patients whom you deliver the medications dispense will have psychotropics. Do you all agree with me? You know what psychotropics mean? What are these drugs? My topic will deliberate on all those aspects. In general, whatever the drugs used in psychiatry are called as psychotropics. Is it clear? And can someone take them on their own without any prescription? Like how you take over-the-counter medication, paracetamol, brufen, can you take them? You cannot, isn't it? So as the budding pharmacist, trained in B.Pharma, M.Pharma, whatever your PharmD or whatever, you need to know the basics of psychiatric drugs, what are the do's and don'ts, and what may be the implications when a patient comes for a refill without a doctor's prescription. There could be a chance for suicidal attempt or self-harm, and so many practical implications are there. Plus, if at all you notice some signs of overdose or the toxicity, as a pharmacist, when you are involved in patient care, it's your duty to acknowledge that, report that at the earliest, because patient safety should not be compromised. With this brief introduction to the subject, I will move on to my slides, and since the organizers have taken such a time to arrange you all in this hall, since the first session, I do understand the struggle to put you all in one hall by 9:30 you were scheduled, already delayed by 45 minutes. And before the inaugural, I think I have to compress my presentation. So, if you permit me, I'll go to the presentation. So, this is my KMC where I work for. I'm done from MBBS, MD, and faculty for the 34 years I was with KMC Bangalore. I'm proud of my university and I'm here to represent and greeting from KMC Beyond. So, topic title I have kept it as psychotropics use and monitoring. We need to monitor them, and many times patients, when they are prescribed, they are scared to take. Why they don't take? So antipsychotics belong to that class of disorder where the psychosis or the unsoundness of mind, or the older terminology, lunatic, what we call, that comes under that. There is so much stigma that psychiatry means schizophrenia. No. Psychiatry will deal with lots of positivity, work-life balance, how to handle the stress, all that we deal with. So it's not just medication, but since you're all specialists in pharma, I have to talk only about medication. So I restrict my talk to the subject only. We have the mood stabilizers. Anybody knows what mood stabilizer means? Where are they used? We know about depression, we heard about schizophrenia. What is mood stabilizer? Who are the clients who give mood stabilizer? You would have heard someone talking very high and very low in a short course of time. They are all having bipolar. Have you heard of bipolar? Patients with bipolar illness need mood stabilizer. That's also a lifelong illness. If you don't treat, the illness will keep coming like a cycles. How like Olympic comes every 4 years, the cycle of bipolar, mania, depression comes in a cyclical fashion. If you don't treat, the end is disastrous. Patient can be dangerous when they are mania, or when they are depressed, they can be suicidal. So we have to put them on mood stabilizer. I will be talking about each class of drug as a prototype for you to know the nuances of prescription and the precautions. The last drug, anxiolytics and sedatives. What do you mean by anxiolytics and sedatives? Who are the victims who use them? Where do you got a PhD. That means you can have your varied interest as a pharma student to do that. So today if I am here, all the credit should go to Pooja. I am proud of you, Pooja. She got many. She was one of the best PhD scholar in our university. She had gotten many accolades during the presentation. One of the highest grants she had gotten just for this topic which she worked with us. Is that clear? So this is very important for me, metabolic syndrome, which she worked upon. You might wonder what metabolic syndrome is all about. Once you put on psychotropics for long, which is a lifelong illness, as I told, patient can become diabetic, they can have dyslipidemia, they can have heart attack, they can have various insulin resistant state which could end up in a disaster unless you monitor them. So her whole PhD work was to know the stakeholders awareness, pharmacists, doctors, clients and their difficulty, current practices and how to prevent. So she developed an app to make it user friendly for the patients. So I really proudly say that this is a research which is rewarding probably an award per se. Such a good work she has done. And this metabolic syndrome, we'll talk about it in the end again. This is one of the side effects of antipsychotics. What is dystonia? Click on the title. Patient on antipsychotic, they have kind of hand twisting. It's like hand going to spasm, and it's very painful. It's one of the acute side effects. You have to be careful. If one of your patients are putting this medication, neck tilts to one side, called as cortical. These are all the acute side effects. It is called as dystonia, which could be life-threatening. If there is a laryngeal dystonia, patient has spasm and may die. So these are the acute side effects which you should be aware of, see only when the acute treatment has begun with. I think you can go to the normal slide. It's inside the PPT. Then patient can have akathisia. Akathisia is another side effect. Anybody knows what is akathisia? What is akathisia? All of you are supposed to report adverse drug reaction, isn't it? We never heard of it, we will not pick them up. Akathisia meaning once you put the patient on medication, patient cannot sit or stand in one place. He will be moving up and down and walking sideways. Cannot keep his feet together. He will be moving like this. This is called akathisia. It is also distressing, and people may think he is just doing some exercise. Not so. Next about dystonia. This is the akathisia. Slide is there. I hope they can play the side button on the way inside the PPT. Then comes Parkinsonian symptoms. What is Parkinson's? Anybody knows what is Parkinson's? So, what is the difference between drug-induced and the real Parkinson's? Parkinson's is a disorder of brain degeneration in elderly. Antipsychotics can simulate the condition at the young age, which is nothing but medication what you are given gives him to tremors, rigidity, slowness while walking. If somebody is walking like a statue or a robot, it's nothing but you have induced a state which could be treated. Again, treatment for that is specific. We can give them drugs like triaxiphenidine and so on. In the tardive dyskinesia, if anybody has seen anybody different forms of dyskinetic movements are there. Again, that video can be played, but I am not sure. This kind of movements they keep on doing, which is nothing but your medication has caused this sort of state. Coming to the mood stabilizer, they are used in depression and mania, I told. Lithium is the main drug, valproate is the other drug, lamotrigine. Bipolar disorder, we use these mood stabilizers. Side effects, generally you should know about lithium toxicity. Valproate can be liver toxicity. Lamotrigine could have a Stevens-Johnson syndrome. Anybody for Stevens-Johnson syndrome? What is Stevens-Johnson syndrome? You would have put patient on lamotrigine, immediately comes with skin eruptions, lots of rashes, exfoliative dermatitis, life-threatening. It's a idiosyncratic reaction. So if you are writing some MCQs, all these questions, be ready. If you are writing some MAD or some other exams. Coming to the anxiolytics, which are given for the stress disorders, general use drugs are diazepam, clozapam, zolpidem, etc. Zolpidem is a non-benzodiazepine. It is a hypnotic agent. They are useful for insomnia, for the short sleep disorders. Side effect. I would have written anti-sleep disorder pill or an anti-anxiety for a 1 week. I have patients who have come with some other prescription for 10 years. They are still on sedatives. You can see the damage done to the brain or to the individual, without which they cannot live a life later on. So whose fault it is now? Is it doctor's fault? Is it patient's fault? This is the pharmacist who keeps on refilling it without the prescription. Time has come for us to waken up. Because that is dependent, it's equivalent to alcohol dependence. So before you put anxiolytics for any patient, think twice. Or if they want to commit suicide, they can eat your whole lot of prescription medication and make an attempt, but they don't die. They will be in ICU for a while, then they come out. It doesn't kill. It will suppress your breathing. If you are not taken timely help, you may need ventilator support and you may have brain damage. But it doesn't kill you, but it makes your life paralyzed. So be careful with any drug which is being used indiscriminately by the patient or by the unauthorized prescriptions. I had written some medication for one of the students. Then I get a call from pharmacist from Pumpwell after a month. Doctor, have you written it today? I don't know which patient. Then he shared the screenshot with me. He has made a duplicate color print and edited and done and repeated. Then I told the pharmacist, kindly send the student to me, I want to talk to him. He came frankly. He told he's giving it to all his bandmates who needed the sleep pills for benefits. So this kind of practice is really alarming. Don't do all that. So these can cause role of pharmacist here is to counsel the patients if you are in a ward or a clinical site working with it. Look for the side effects, report all the adverse areas and identify the drug-drug interaction which we will be talking in a while and reporting to the system. Case 1. Anybody can guess lithium aside and danger. What happens in lithium therapy? A 45-year-old woman presents with bipolar, as I told, she's on lithium, presents to pharmacy, complaining of nausea, vomiting, diarrhea, muscle weakness. She recently started taking ibuprofen for headache, migraine or whatever. What has caused to the lithium and ibuprofen interaction? Anybody? So always be aware of minor change in the patient's prescription given by the co-physicians, and when you don't brief them about a possible side effect, it could be life-threatening lithium toxicity. Lithium toxicity could present like this. Here ibuprofen has contributed to the synergism, and pharmacist's role is to identify this and serum lithium to be done. What is the serum lithium level generally for bipolar? If you don't know the safety, you are not doing a good practice. What is the ideal level in the blood? Anybody? 0.7 to 1.1 milliequivalent. I give 900 milligram lithium, blood level will be 0.8. I give 1200, blood level would have shot up to 1.1. I give 1800 or 2000 milligram lithium, will be lithium toxicity, because lithium is a drug which has got a very, very narrow therapeutic window. I hope you understand the term therapeutic window for a drug. Do you all know? Better know it. If you don't know many of the terms what I will say. So serum lithium to be checked. Does the patient go to lab? No. He doesn't have to spend time. He doesn't have money. He doesn't have a lab which does serum lithium. It should be analyzed in a specific lab. In KMC, when you send the lab reports, it goes to Manipal to central lab and gets back after 1 week. But if the patient has lithium toxicity, he may die out within no time. So how to handle that? All that will be a question for you all to ponder. So key points here is NSAIDs can increase the lithium levels to the toxicity. The patient present with these tremors nothing but lithium toxicity, which you missed out. Second case, clozapine with a fever emergency. Can anyone guess what happened to the clozapine and the patient health? What is clozapine? Antipsychotic. It's an atypical drug. It causes, what it causes? This patient comes with 30-year-old treatment resistant schizophrenia, clozapine. He visits with fever, sore throat, fatigue. What is wrong with this patient? You may think it's a flu, common cold and leave it, but it's on clozapine. What it causes? Anybody? It causes a serious side effect and it is called as agranulocytosis. Heard about it? What is agranulocytosis? The total count comes down. This is the drug which brings down the immunity. The fighter cells are called granulocytes in the body. You would have read about white blood cell, RBCs and all. This drug brings down the level. So unless you monitor the blood levels of total count, patient with the infection, which is the fighter cell, which is not there, it's like giving a fuel to the fire, isn't it? So we have to be watchful about any development of recent cold infection and take care of your clozapine dose also. So this is the clue here. Agranulocytosis is a side effect like that thing. Absolute chlorophyll count you have to do, and clozapine should be stopped immediately. But schizophrenia doesn't stop with the clozapine stopping. As I told, it's a lifelong disease. Can we re-challenge with clozapine again? What does guideline say? Please refer back. I don't have time, but we'll talk about it some other forum. Coming to the third case scenario, SSRIs and depressants. A patient comes with shaky, sweaty stomach. Can anyone guess what has happened? SSRIs, depression, and he comes with this storm-like reaction. What is it called as? No guesses? Again, 27-year-old woman, depression on migraine, fluoxetine. Recently comes with taking tramadol. What is tramadol? You know. For the pain. Now she drug indiscriminately by patient, the chemist or the physician who uses them. We don't prescribe the anxiolytics or any other drugs just for longer than 2 weeks in our practice. So it can be tapered. It should take longer time. Tapering is about 1/4 of a dose weekly, which may take several months to taper. Even then they need substitute medicines. So key point learning here is regulatory cost dependence, withdrawal, seizures. Patient can also throw a fit with the withdrawals abrupt. When the refill doesn't happen, when the pharmacist doesn't give his dependence, patient can get into a rebound anxiety and all that. So we can give alternatives to remove them, CBT and other things are the options. Last scenario, many times medical students come to you who are in academia but having problem with addiction. What are the drugs we are talking? Methylphenidate. Most of the students come to us saying, "Doctor, I have lack of concentration. Can you give some drugs?" I searched on the net. I fit into ADHD, self-diagnosed. ADHD is easy to diagnose, but clinically if I administer, they don't have ADHD. They have a problem with focusing on studies. They are put in all other extracurricular activities. That's not ADHD. Self-labeling, self-proclaiming, asking for a prescription is the clue here for you to know that it could be dangerous. But I am not saying ADHD should not be treated. This is an USFDA approved drug. But indiscriminate use, anything is not to be advocated. So key point here is stimulant misuse is common. Can pharmacists identify them? Counseling should help them to go to their doctors and get back the original prescription if required. Again, they can cause so many problems on long run, like stimulants are used in ADHD with a word of caution. The last syndrome which I spoke in the beginning, syndrome X I have mentioned, nothing but metabolic syndrome. Olanzapine is the drug we have implicated. Most of them will have glucose and lipid abnormality. So psychotropic drugs carry higher risk. Pharmacists should monitor for all this and lifestyle modification. When you put a patient on olanzapine risperidone, which is a lifelong, which you take like a should advise them to have healthy habits of balancing the weight, walking a bit, eating a healthy diet. They don't do all that. They only blame you that your medication made me gain weight. So lifestyle modification is the good point here. Since I've been told to conclude, since there are inaugural session to begin with, I'll just conclude here with that all the atypical antipsychotics carry the high risk. Switching to lower risk strategies could be an option here. So closing section, I would like to say general monitoring for required for psychotropics. Patient education is a good point to adhere to what is being prescribed, beware of side effects, lifestyle changes. Monitoring guidelines includes if it's antipsychotic, maintain lithium serum levels, clozapine, blood count, benzodiazepine, risk of dependence, and manage the drug-drug interaction. With that, I stop here and take any questions. I have quite a more slides to accomplish, but I stop here with the time given to me is over. Thank you.
If anyone has any doubts or clarification, please raise your hands. Thank you, sir, for sharing your incredibly wise intellect. Your profound knowledge and perspective have been truly enlightening and will undoubtedly leave a lasting impact on us all. I would also like to thank Dr. Jagadishri Kamath and Dr. Karunakar Hegde for being here for the plenary session.
Open for discussion. Anybody is having one or two questions, they can ask. There is no much time actually. They can raise their hand. In the beginning of the presentation, he has given the example of one of the student. That student is my student only. Actually, only 1 minute I explained here. 2 days back, one student who is studying in 3rd year that student in first 2 semesters was the topper. And third semester, first sessional he scored 1, 2 like that way. Second sessional also he scored in the same manner. So his parents, they got agitated and they came to the college. I called all the teachers also and parents also. Is there any solution for this? He was telling, my father drinks, that is why I am having some kind of depression. But later we came to know that his father doesn't drink at all. He was bluffing. So I was talking to the doctor, what is this actually? But the parent as well as the teachers, we cannot solve this type of problems. I think counseling along with that, some kind of medication is also required. That is what doctor said. It is not a dangerous disease as such, but it can be treated in the beginning only. So I have to send the student to a psychiatrist like doctor. I think there is a solution for this. What way I am telling all these things, every day we see students and many people, because of the different problems, they suffer from this type of disorders. So proper treatment is required. We should not ignore these things. Doctor has very well explained about the drug interactions caused when two one drug increases the activity of another drug, how it is dangerous. And he has also explained different type of side effects caused by antipsychotic drugs, like metabolic disorders, dystonia, Parkinsonism type of syndrome. I think this session was very much useful for all the delegates who have come here. Once again, from my side, I thank the doctor for giving a nice presentation. Thank you.
I would like to thank Dr. Jagdish Sri Kamath and Dr. Karunakar Hegde for being here for the plenary session. I request Dr. Jagdish Sri Kamath sir to present a memento and certificate to Dr. Keshava Pai. I request Dr. Kumar Prasad sir to present a memento to the chairpersons, Dr. Jagdish Sri Kamath sir and Dr. Karunakar Hegde sir.
Bangalore is known as an education hub. Many students from different places come to Bangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant. Bangalore is known as an education hub. Many students from different places come to Bangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant and visionary academician, Dr. C. A. Raghavendra Rao started the first educational institution, that is Srinivas College of Hotel Management, in the year 1988. Today, more than 13,000 students are pursuing their higher education at Srinivas University and Srinivas Group of Institutions. Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Srinivas Group of Colleges, Mangalore, is an eminent personality. The university has also recognized his contribution in managing higher education institutions effectively. The group has established many milestones in the quality education in the field of healthcare, medical, dental, paramedical, allied health sciences, hotel management, engineering and technology, physiotherapy, nursing, aviation studies, port shipping and supply chain management. The university has established networking with many industries, universities, and education services providers to substantially improve the quality and weightage of the course and degrees respectively. Presently, Srinivas University has 9 institutes offering innovative industry-oriented specialized courses of UG, PG, and research levels. The Institute of Engineering and Technology is a constituent college under Srinivas University located at Mukka, National Highway 66, Mangalore. The college campus is developed in a lush green environment with well-qualified and experienced faculty, state-of-the-art laboratories and research facilities in the field of engineering, technology and management science as per international standards, with the aim of creating technically sound engineers and decision makers who can establish themselves successfully in the industry and global market. Robotics, artificial intelligence and machine learning, cyber security and cyber forensic, data science, cloud technology and information security, and blockchain technology and distributed computing. The College of Engineering and Technology is on the threshold of a quantum leap. Institute of Allied Health Science. Srinivas University serves with medical facilities too. The college's clinical requirement is fulfilled by Srinivas Hospital, which is a 700-bedded super specialty hospital. We have separate hostels meant for boys and girls. Srinivas University Institute of Nursing was established in the year 2019 with the commencement of the BSc program under Srinivas University, located at the Srinivas University campus, Mukka. The Srinivas Hospital is also located on the same campus and offers an excellent opportunity for students to be trained in a medical college hospital. The courses are well recognized by the concerned nursing councils. The Institute of Management and Commerce, earlier named as Srinivas Institute of Management Studies at Srinivas University, is committed to providing conducive learning environment. Institute of Computer Science and Information Science is envisioned to offer courses which would build the students into enthusiastic quality professionals in the field of computer science and information technology. Since 2005, The college is associated with several MNCs like Infosys Technology, Wipro, IBM, Accenture Technology, TCS, Tech Mahindra, Dia Systems, Spanios Technology, and many other in-placement activities. All-out undergraduate and postgraduate students get good placement through College Placement Program. Institute of Aviation is a constituent of Srinivas University. The college encourages the study of airlines, airports, and business related to the aerospace industry. This also includes supervising routine operations undertaken by the ground staff of an airport or an organization in the aviation sector. Institute of Hotel Management and Tourism offers a Bachelor of Hotel Management and Catering Technology and a BSc Hotel. These programs are focused on the aspect to create professionals who would be the future leaders of the hospitality industry. Practical exposure and experience students will get from working in Hotel Srinivas and Hotel Saffron. Srinivas Institute of Physiotherapy was founded in the year 1993. From the year 2017, the college has become a constituent of Srinivas University. It is the first college which has designed the course curriculum to meet all overseas credentials. The college also has a wide network of alumni spread across the world in various managerial responsibilities. Undergraduate and postgraduate courses in physiotherapy are available on the Pandeshwar campus. Srinivas College of Pharmacy was established in the year 2004, offering both postgraduate, diploma and doctoral courses in pharmacy. The college is located at the VALACHIL campus of the Srinivas Group of Colleges with picturesque surroundings. The Srinivas School of Architecture, established in 2012 with a B.Arch degree under VTU University and is a part of Srinivas Group of Colleges. The school currently offers 5 years B.Arch program, Architecture Studio, Exhibition Space, Climatology Lab, Material Museum, Survey Lab, Model Making Studio, Specialized Classroom, and good canteen facility is the highlight of this campus. Srinivas Institute of Technology was established in 2006 with the aim of producing world-class technology graduates tuned to the demands of a fast-changing global village. SIT has gained the name as the best self-financed engineering college in Karnataka in terms of infrastructural facilities. Srinivas Institute of Technology is a unit of Srinivas Group of Colleges, Mangalore. 5 departments have been recognized as research centers by VTU to pursue PhD and MSc. The institute has well-qualified, committed and motivated faculty.
Sir, Professor, Srinivas College of Pharmacy and coordinator of today's function to escort the dignitaries onto the dais and join them. Please be seated.
together is a beginning. Staying together is progress, and working together is success. A very warm morning to all the delegates, invited guests, professors, and my dear friends. I, Jocelyn Dias,
And I, Jessica Fernandez,
of 6th Farm D, on behalf of Srinivas College of Pharmacy, VALACHIL, Mangalore, and Indian Pharmaceutical Association, Local Branch, Mangalore, are delighted to graciously welcome all of you to the 7th National Conference on Innovative Practices in Clinical Training and Patient Safety, IPCTPS 2025.
it is our greatest honor to host today's event.
Music has the power to connect our souls to the divine, and prayer through melody brings harmony to our hearts. Music can heal one in many ways that cannot be seen by an untrained eye. Let us now invoke the blessings through a prayer song to uplift our spirits. I invite Ranjita and team to lead us with the invocation song. I kindly request everyone to rise.
Please be seated. In the presence of greatness, respect is paramount. And on this auspicious day, we are amidst certain notable visionaries who have continuously pushed beyond the current limitations to grasp onto knowledge for the betterment of humanity. Hereby, I request Dr. A.R. Shabaraya, Principal of SAP, President IPA Local Branch, Mangalore, to introduce and welcome our dignitaries to the gathering.
President of today's function, Dr. C.A. Raghavendra, Vice Chancellor, Srinivas University, President A. Shamarao Foundation, Chief Guest, Dinesh Chandra Hegde, Managing Director, Vasudha Pharmaceuticals, Brahmavar, Guest of Honor, Dr. Srinivas Rao, Pro Chancellor, Srinivas University, and Vice President, A. Shamarao Foundation, Mangalore, members of Executive Committee, Indian Pharmaceutical Association, principals of various pharma colleges, as well as members from pharma industries, principals of sister institutions. I take the pleasure to welcoming all of you to this 7th National Conference on innovative practices in clinical training and patient safety during this 4th and 5th April 2025, which is organized by Srinivas College of Pharmacy in association with Indian Pharmaceutical Association Local Branch Bangalore and RAJIV University of Health Sciences Bangalore. To enhance the academic training, uphold professional standards, and stay at the forefront of advancement in the field, this conference is arranged, and by facilitating meaningful discussions and professional networking, this conference will serve as a catalyst for academic excellence, research innovation, and interdisciplinary collaboration, ultimately shaping the future of pharmacy education and practice. With this intention, Srinivas College of Pharmacy has taken initiation, and this is the 7th year we are organizing, and I am very happy to share that already 13 universities are participating and more than 28 colleges are participating in this event. And at this formal function, I take the pleasure of welcoming our President, A. Shamrao Foundation, that is Dr. C. A. Raghavendra Rao, who is agreed to raise his vocation. From the beginning of his professional career, he was nurturing a dream of transforming and empowering the society through education. He has realized his dream by establishing a trust called A. Shamrao Foundation, Bangalore, in 1988. Under this trust, he started many professional colleges to impart professional education in hotel management, management studies, pharmacy, physiotherapy, nursing, engineering, general education, dental sciences, and medical sciences. With the intention of providing affordable health care, Dr. Raghavendra Rao has started 750-bedded hospital, Srinivas Teaching Hospital at Muka. This hospital is attached to the Srinivas Institute of Medical Sciences and Research Center, a premier medical education institution. Dr. Raghavendra Rao has continued his untiring efforts and established Srinivas University in 2013 by Karnataka State Act. It is a research and skill-focused university and flagship of 18 institutions. Today, Srinivas University and Srinivas Group of Institutions are spread in 4 campuses. Considering his AON services in the field of education, his philanthropic activities, community-based services, his entrepreneurial skills in the hospitality sector, excellent knowledge in chartered accountancy, he was awarded honorary doctorate degree by the Apex University, Arunachal Pradesh in 2021. Further, many cultural, religious, and professional organizations have bestowed with many honors and awards. To name a few: Sri Krishna Anugraha Award, Local Shastra Seva Pravina, Outstanding Manager Award, Achievers New Year Award, so on. Dr. C. A. Raghavendra Rao is a complete man with unparalleled professional skills, administrative acumen, outstanding philanthropic nature, and simple, pleasing manner. Sir, it is my honor to welcome you in this august gathering. The day is blessed by the presence of Sri Dinesh Chandra Hegde, Managing Director, Vasudha Pharma, Brahmagar. Sri Dinesh Chandra Hegde, after completing his SLC from Sharda High School, Cherkadi, moved to Mumbai for further studies, and he has completed his graduation from Mumbai University and post-graduation in Materials Management from Indian Institute of Material Management. He started his career in pharma industry in 1981 and has got rich pharma experience working in various departments. And he has got retired from Lupin Private Limited as Vice President Global Sourcing. And he started his own manufacturing formulation unit in Brahmavar, employing more than 150 employees, supporting a rural economy. This is the only pharma company in Udupi district with this, he is supporting all the pharma sectors. And sir, I take pleasure welcome to this guest gathering. The day is also blessed with the presence of Dr. A. Srinivas Rao, Vice President Shamara Foundation and Pro Chancellor Srinivas University. Dr. Srinivas Rao has rich and diversified experience of serving New Mangalore Port Trust, Mangalore SEZ and Rotary Club of Mangalore. He is the Director of Hotel Srinivas, 3-star vegetarian hotel and proprietor of Udupi Sri Krishna Bhavan, Mangalore. His sustained hard work, entrepreneurial skills, administrative acumen, charitable nature and inclusive policy decisions came in handy while assisting his father, Dr. C.A. Raghavendra Rao, in shaping the destiny of Srinivas University and Srinivas Group of Institutions as centers of ethical and value-based education. Sir, it is my honor to welcome you, sir. Today we have with us the principals from various pharmacy colleges and healthcare institutions from Andhra Pradesh, Tamil Nadu, Kerala, Karnataka. And I am happy to note already 13 universities are representing this conference, and I extend hearty welcome to all the principals who are gathered here for their kind support for this pharma professional group. And I also extend my hearty welcome to all the executive members of IPA, Secretary Vijayanarayan, and Organizing Committee, Dr. Krishna Kamath, and all my colleagues. And mainly this program is totally organized or initiated from our interns, the farm interns every year, and I extend hearty welcome to all and all the participants. Thank you.
Thank you, sir, for your brief introduction and for the warm welcome.
Flowers are nature's way of spreading joy and warmth. When flowers bloom, so does joy. Just as every petal adds to the beauty of a flower, your presence adds grace to this occasion. To honor our esteemed guest, we now present a floral welcome as a token of our respect and admiration. I request Dr. A.R. Shabaraya sir to welcome our esteemed President, Sri C.A. Raghavendra Rao, President, A. Sharma Rao Foundation, President of today's program. I request our President, C.A. Raghavendra Rao, to welcome Sri Dinesh Chandra A.A.K., the Chief Guest of today's function, and honor him with a shout. I now request Dr. Padma ma'am to welcome Dr. Srinivas Rao, Vice President, A. Sharma Rao Foundation with a bouquet of flowers. I request Professor Ram Prasad sir to welcome Dr. A.R. Shabaraya, Principal SEP, with a bouquet of a flower. I request Dr. Shripati to welcome Dr. E.V.S. Subramaniam sir with a bouquet of flowers. Thank you, sir. I request Professor Gopi Krishna to welcome Dr. Vijay Narayan, Secretary, IPA Local Branch, Mangaluru. I request Mrs. Vijayashree to welcome Dr. Krishnanand Kamath, coordinator of today's function, with a bouquet of flowers. I request Dr. Veeresh Chandru and Dr. Kumar Prasad, professors, to welcome the special guest of today's function by giving bouquet of flowers. The special guests are Dr. Srinivas Rajan, Professor and Head, Department of Pharmacy Practice, MPOPS Mahe Manipal; Dr. Mohammad Gulzar Ahmad, Principal, Enukoya Pharmacy College and Research Center; Dr. Prashant Chandra, Assistant Professor, Department of Pharmacy Practice, Amrita School of Pharmacy, Kochi, Kerala; Shri Nikhil Hegde, Director, Vasudha Life Science Private Limited; Dr. Sridharan, Associate Professor; Dr. Mallikarjun Gowda, Principal, Prasanna College of Pharmacy; Dr. Guru Raj, Principal, Vivekananda College of Pharmacy; Dr. Sujit Nayak, Professor; Dr. Srinivas Mayadi, Principal, Srinivas Institute of Technology; Dr. Pradeep, Principal, Srinivas Institute of Nursing Sciences. Thank you.
The light of a lamp symbolizes wisdom, knowledge, and triumph over darkness. When light ignites, the deathless doom cannot persist. As we kindle this flame, may it illuminate our path towards success and enlightenment. May I now kindly request all the dignitaries to inaugurate 7th IPCTPS 2025 by lighting the lamp. I also kindly rise.
Thank you everyone. Please be seated. I request Professor Veeresh Chandru sir to welcome Dr. Jagdish Kamath sir and Dr. Keshav Pai sir by bouquet of flowers. Thank you.
Moving forward, we come to a moment of pride and achievement, the official release of our magazine, abstract and publication. This release encapsulates the dedication, research and academic excellence of our institution. The magazine captures key milestones and the community contributions. The abstract book reflects researchers' dedication and findings, and the publication showcases impactful scientific advancements. We now invite our esteemed dignitaries to do the honor of unveiling these works. Let's mark this moment with a round of applause. I request the dignitaries to unveil the abstract book. I also request the dignitaries to unveil the publication 2025. Thank you.
We are delighted to have with us Sri Dinesh Chandra A. Hegde, Managing Director of Vasudha Life Sciences Private Limited, Brahmavara, Udupi, as the Honorable Chief Guest of today's function. I now formally invite Sir to share a few words with us.
And this August gathering. It is an honor and a proud moment for me to address this expert this conference of innovative practices in clinical training and patient safety. My association with the pharma for the last 45 years helped me to acquire certain knowledges and also experience from my industry. In India, I worked with the multinationals, Indian multinationals rather, for many years in different departments and various positions. This helped me to think of after retirement putting a plant in our district. After acquiring wealth, knowledge, in certain point of time we should give to the society also. So why not to put a plant in Udupi where there are a lot of pharma colleges in Dakshina Kannada and Udupi districts who can also get the exposure for manufacturing, research and development. We have already signed MOA with Srinivas College of Pharmacy and also MPOS. So many students are coming there and learning and doing their internship. I am happy to say that in the rural industries, we are employing around 150 people, giving a boost to the rural economy. As I said, this is the era of Indian pharmaceutical company. Indian pharmaceutical company aspires to reach the milestone of $130 million by 2030 and $450 billion by 2047 as a part of the India 100 vision. This upward trajectory will be propelled by the industry's commitment to innovation, integration with the global pharmaceutical landscape and access to integrated healthcare. Nurturing of talent, development of essential skill set and expansion of capacity will be indispensable elements of underpinning this ambitious growth. Recognizing as the pharmacy of the world for several decades, the Indian pharmaceutical industry has garnered global acclaim, particularly for its leadership in the generic drugs. It commands over 20% of the global generics supply by volume and approximately 60% of the worldwide demand for vaccines. So this is the reason why Trump cannot touch Indian industry. You all heard, you all read that he cannot increase the duty for Indian pharma exports. And if you see that because of Indian pharma generics, the US extractor for last 20 years almost has saved $3 trillion. So this is a credit goes for Indian pharma industry. Beyond its global impact in improving the health outcomes, the Indian pharmaceutical industry plays a pivotal role in propelling the country's economic growth and generating employment. How we can achieve the vision of 450 billion by 2047 and how young minds like you can contribute. Unleashing pharma's value-driven research and innovation potentials. Disruptive innovation is not just an innovation but innovation on time has to be achieved. This can be achieved by collaboration between industry, academia and government and startups. This will also help substantially contribution to the country's innovation ecosystem by fostering the talent and skill development throughout the value chain. This is what Vasudha Life Science has done, and we are one of the preferred destinations for contract development and manufacturing. In last decade, we have nearly given around 200 of pharma professionals to the ecosystems, becoming an integral part of the futuristic global pharma supply chain. Advancement of manufacturing technologies by leveraging AI in drug discovery, building creditability in the global market with the commitment to quality. We are the first WHO standard site in Udupi districts, and we aspire to bring global practices to this place. Adopting sustainable practices. Achieving sustainable and equitable healthcare access to all. Achieving equitable and sustainable healthcare access is a must for the country to achieve economic growth. Government of India has launched several initiatives to provide healthcare access to the population like Ayushman Bharat, a significant step towards achieving universal healthcare coverage in the country. Ayushman Bharat digital mission is aimed at laying the essential groundwork for a seamless integrated digital healthcare infrastructure in India. These initiatives are expected to improve access and reduce costs, enabling coverage of large part of the current underserved population and revolutionize access to health care and delivery. So there is a bright future for Indian pharmaceutical industry in coming years, and you all pharma graduates will have a bright future ahead. I invite you bright minds to take the leverage of our R&D to propel your research and use our site as a launch pad for your achievements. Wish you all the best. I thank the management of Srinivas College of Pharmacy for giving me this opportunity to address on this occasion. Thank you.
Thank you, sir, for your inspiring words.
We are happy to have with us Dr. A. Srinivas Rao, Honorable Pro-Chancellor of Srinivas University, Bangalore, and Vice President of Ashamara Foundation, Bangalore. May I now kindly request sir to speak a few words.
President of today's function and Honorable Chancellor and President of Srinivas College of Pharmacy, Dr. C.A. RAJIV, Chief Guest of today's function, Sri Dinesh Chandra, other dignitaries on the principals of sister universities, principals of various colleges, pharmacy colleges are gathered here, participants, faculty members, and our students. First of all, let me congratulate our students who have brought up the 7th wonderful IPCTPS, that is Innovative Practices in Clinical Trials of this. Yes, now the department as such is like that pharmacy means the concept comes is innovation. Why is that? Because everything is changing. The global scenario, if you see, entire thing is changing. What was considered to be a pandemic or what was considered to be a disease is no longer a disease, because it can be withstood by the people like you, that is the pharmacists, who have taken up the initiatives to innovate and get the product and see that disease is cured at rapid way. And I can tell you, we are all proud because we have come up with the world's pandemic just 2020, 5 years back. The COVID was eradicated, and that, I think, the major part was taken by Indians, and we are proud of it for that. Coming now to the students as such, what we have seen here is they have all participated in very good things, because we have got 230 publications. The abstract says that 230 publication has come out from our students, and I congratulate them for that effort. I also appreciate the participants here, because this is the first time I'm hearing that all the southern states have united for innovative practices. I compliment them for taking that effort and coming here and participating. Yes, the more and more you attend, the more and more you get the knowledge, and more research will come up in the field, and it will be a contribution to the nation as such. Pharmacy and the clinical trial. Yes, Chief Guest has already told how we should become the sustainability of the pharmacy and the Indian standard, and the government intervention, the government facilitates how the pharmacy industry has to thrive here. But my personal feeling, I'm not a technical person, but I personally feel that whatever innovation, whatever new molecule which has to come, it takes a lot of time. I feel that there should be some consideration in between. There should be a break and see that it is expedited. The regulations has to be what we call as streamlined. The reason why I'm telling this now, we have got a lot of other technology also. Why not you club the technology and find out how fast you can come up with the new molecule? That is what we want to see, because now we know that how the technology, engineers have come up with the artificial intelligence. So when we have artificial intelligence, the database, whatever you have got, you can have interface with the artificial intelligence and come up with, as far as possible, come up with a new molecule at the earliest. It is possible, I feel it is possible. A day will come where there will be a proper interface between the new innovation, what you are doing, and the artificial intelligence, so that the whatever product which comes up will be safe. What I feel will be safe when you say that there is a merge of both the technology and the innovation. Well, that are the things which has to be sorted out by a discussion like this. A conference like this will envisage this kind of things where you can merge the technology and the innovation and see that you expedite and the regulation also can be amended so that you all can be having a better prospects in the future. Well, there is a lot of things which is happening after this. I wish all of you a happy session here, enjoy the session here, and also gain more and more knowledge when you come out of this conference. I wish you all good luck. Thank you very much.
Thank you, sir.
A true leader illuminates the path for others, for he is a beacon, guiding endlessly towards a fruitful victory. Now I request our most honorable and respected principal, Dr. A.R. Shabaraya, Principal and Director of Now I request our most honorable Dr. C.A. Raghavendra Rao, President Sir, to address the presidential address.
Distinguished and honorable Chief Guest of the Day, Mr. Yes, I was thinking whether Dinesh Chandra or Chandra, yes, Dinesh Chandra might be. Because both are good. Dinesh is bright light and Chandra is soft light, very pleasing light. So Dinesh Chandra, the CEO of Vasudha Life Practices, Life Sciences, Private Limited, and the faculty members here, distinguished humanities, distinguished guest speakers, distinguished resource persons, and my dear students. Students means they are all learners, top prospective pharmacy executives. I am very happy that a convention or conference of this type has taken place. Innovative practices, this is the key word of the day, I tell you, and clinical training and patient safety, that is most important. Patient safety, I tell you, every day you find in the newspaper that the negligence on the part of the people who administer the medicine and the consequences of that by the patient or patient relations, whether it is the crime is deserved or not, but there will be hue and cry in such cases. For that, the skill is must be different. Skill of the training skill, you must have the clinical training and practices patient safety. In that, if you are trained well, I think there will not be any negligence, because I know there was one doctor, his OBG doctor, specialist, I tell you that I think after her name, I do not know to name, she, of course I can name her, she is not there now, Dr. Lydia Colasso. She had all 26 letters added to her name only. All qualifications all over the world she had in OBG. And she used to say, she has such wonderful training everywhere, that she said, any case, it's a play for me, because she has developed that skill to that extent. Yes. Any complicated case she could treat very easily, and there was no failure in her case at all. Yes, she was my patient, my client for so many years until her death, and I have been enjoying her company whenever she visits my office. I used to speak about her skill only. This was a wonderful skill she had, and that is why in our university, in all subjects, we give importance to clinical training and skill development. In all subjects it is required. Wherever human activities are there, wherever you are involved, I tell you, skill and clinical skill are the skill, and training for that is required. We have, I think, a clinical lab and a research lab in Buka, and that is coming up in a big way. And any disciplined people will be able to get the necessary training from that body there in the Buka. So the government of India also is giving a lot of importance to skill development, and in our courses, probably in almost all the courses, we have got special training in batches for skill development training only is there in special batches for different types of students. I wish this type of training in conferences like this will be very useful, and I am sure by the end of the day, when the conference tomorrow will be attended, you will be unknowingly richer in knowledge, richer in skills, and you will be very much confident that you will be able to handle the case or patients or the outside world very well with your deserving knowledge. With this, I wish you all good luck. I also congratulate all those who are involved in organizing this conference and inviting so many people from all over South India. Different universities, different colleges have participated, and they have been supplemented with the knowledge of professors in and around this district. Resource persons, I thank you for having participated here to take your role in training the youngsters, and I personally thank Dinesh Chandra Hegde, the CEO of Vasudha Life Services, for having come here and given his expert knowledge and the challenges available for the youngsters when they go out to join the industry, and also the scope of the industry that is they are going to do, how fast it is developing and all that. So this information is very much available. I think that is a very good role for you to play when you complete your education and get the proper training and skill. Training in and skill also. So with this, I wish you all good luck. I am sure all of you will be rich in knowledge by tomorrow evening, and that will be very useful to your future career. Not necessarily you should only do the marketing business. You can do so many other things also. This is what we are learning today, is a foundation for your career. With this knowledge, you can become a politician, you can become a manager, you can become an executive anywhere, in any field, provided you have got a lot of common sense to adjust your knowledge to suit the different conditions. There are enough scope for it. What you are learning here now is only foundation is being laid for your future career. Future career is different. That is why training and skill easy training also is given to you, because just theory knowledge, you will not be knowing what to do, how to do and all that. I have got my own example. I passed my BCom with a distinction from Madras University. But when I came and joined in the auditor's office for doing my articles for CA course, I tell you I did not know how to do the postings, how to check the daybook and lecture. It was very simple. You know who taught me? It is a person who has passed SLC but got training in that office for several years. So it is skill development, practical aspect of the theory is very much important, and that you must be able to pick up during the current days during the college, because even if you have, you are a student, you can, that is the excuse of it. But when you go out and have, it will be serious offense against the society. So learn well, get the training also properly, get enough knowledge, and when you go out, you should be knowledge, full of knowledge, to face the outside world independently. Thank you very much. Wish you all good luck.
Thank you, sir, for your enlightening words.
As a token of gratitude and honor, I now request Dr. C.A.A. Raghavendra Rao, Honorable President Sir, to present a memento to Dr. Sri Dinesh Chandra A. Hegde, Chief Guest of today's function. Thank you, sir.
Gratitude is not only the greatest of virtues, but the parent of all others. As we come to the closing inaugural ceremony, I invite Dr. E.V. Subramanian Sir, Professor and Head of Department, Pharmaceutical Chemistry, SEP, to propose the vote of thanks.
We have come to the end of the function. As a part of the itinerary, I consider it is my pleasure to express the gratitude to the dignitaries who are all present over the dais and also who are all present in the proceedings. I thank Dr. C.A. Raghavendra Rao, Chancellor, Srinivas University, and President, PHARMACEUTICAL Foundation, for being with us by sparing his valuable time. Sir, thank you very much for your presence. I thank Sri Dinesh Chandra Hegde, Managing Director, Vasudha Life Sciences Private Limited, Brahma Murthy, for being with us and gave us valuable information. Sir, thank you very much. I also thank Dr. A. Srinivas Rao, Honorable Pro-Chancellor, Srinivas University, and Vice President, PHARMACEUTICAL Foundation for being with us. Sir, thank you very much. I also thank Dr. A.R. Shavraya, the Principal and Director, Srinivas College of Pharmacy, and the President, IPA Local Branch, for having organized this function and monitored these proceedings. Thank you very much for this. I also thank other Executive Council members, Dr. K. Vijayarayana and Sridharan, for being with us. Thank you very much. I also thank my colleague, Dr. Krishna Kamath, for having organized this function. I acknowledge and thank the presence of Dr. Gulzar, Principal, Innova College of Pharmaceutical Sciences, Guraj, Principal, Vivekananda College of Pharmaceutical Sciences, Mallikarjun, Prasanna College of Pharmaceutical Sciences, Dr. Jagdish Kamath, Sridevi College of Pharmaceutical Sciences, Dr. Sujit Nayak, Vice Principal of the Professor, Dr. Srinivas Maya, Principal, Srinivas Institute of Technology, Dr. Pradeep, Principal, Srinivas Institute of Nursing Sciences, for their presence. I also acknowledge the presence of the resource persons who have come from other states and all the delegates who are all present to make this function grand success. Thank you very much, and also thank the organizing team. Thank you.
Thank you, sir. With this, we gracefully conclude the inaugural ceremony. We extend our heartfelt gratitude to all our esteemed guests and participants for their presence. The next session will begin shortly, so we invite you to stay with us for an engaging and insightful experience ahead.
I request Dr. Kamath sir to escort the dignitaries of the days.
Bangalore is known as an education hub. Many students from different places come to Bangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant and visionary academician, Dr. C. A. Raghavendra Rao started the first educational institution, that is Srinivas College of Hotel Management, in the year 1988. Today, more than 13,000 students are pursuing their higher education at Srinivas University and Srinivas Group of Institutions. Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Srinivas Group of Colleges, Mangalore, is an eminent personality. The university has also recognized his contribution in managing higher education institutions effectively. The group has established many milestones in the quality education in the field of healthcare, medical, dental, paramedical, allied health sciences, hotel management, engineering and technology, physiotherapy, nursing, aviation studies, port shipping and supply chain management. The university has established networking with many industries, universities, and education services providers to substantially improve the quality and weightage of the course and degrees respectively. Presently, Srinivas University has 9 institutes offering innovative industry-oriented specialized courses of UG, PG, and research levels. The Institute of Engineering and Technology is a constituent college under Srinivas University located at Mukka, National Highway 66, Mangaluru. The college campus is developed in a lush green environment with well-qualified and experienced faculty, state-of-the-art laboratories and research facilities in the field of engineering, technology and management science as per international standards, with the aim of creating technically sound engineers and decision makers who can establish themselves successfully in the industry and global market. Robotics, artificial intelligence and machine learning, cyber security and cyber forensic, data science, cloud technology and information security, and blockchain technology and distributed computing. The College of Engineering and Technology is on the threshold of a quantum leap. Institute of Allied Health Science. Srinivas University serves with medical facilities too. The college's clinical requirement is fulfilled by Srinivas Hospital, which is a 700-bedded super speciality hospital. We have separate hostels meant for boys and girls. Srinivas University Institute of Nursing was established in the year 2019 with the commencement of the BSc program under Srinivas University, located at the Srinivas University campus Mukka. The Srinivas Hospital is also located on the same campus and offers an excellent opportunity for students to be trained in a medical college hospital. The courses are well recognized by the concerned nursing councils. The Institute of Management and Commerce, earlier named as Srinivas Institute of Management Studies at Srinivas University, is committed to providing conducive learning environment. Institute of Computer Science and Information Science is envisioned to offer courses which would build the students into enthusiastic quality professionals in the field of computer science and information technology. Since 2005, the college is associated with several MNCs like Infosys Technology, Wipro, IBM, Accenture Technology, TCS, Tech Mahindra, Dia Systems, Spanios Technology, and many other in-placement activities. All-out undergraduate and postgraduate students get good placement through College Placement Program. Institute of Aviation is a constituent of Srinivas University. The college encourages the study of airlines, airports, and business related to the aerospace industry. This also includes supervising routine operations undertaken by the ground staff of an airport or an organization in the aviation sector. Institute of Hotel Management and Tourism offers a Bachelor of Hotel Management and Catering Technology and a BSc Hotel. These programs are focused on the aspect to create professionals who would be the future leaders of the hospitality industry. Practical exposure and experienced students will get from working in Hotel Srinivas and Hotel Saffron. Srinivas Institute of Physiotherapy was founded in the year 1993. From the year 2017, the college has become a constituent of Srinivas University. It is the first college which has designed the course curriculum to meet all overseas credentials. The college also has a wide network of alumni spread across the world.
Srinivas College of Pharmacy to invite Dr. M. Srinivas with a bouquet of flowers. I request Dr. Muhammad Gulzar Ahmad, Principal of Yanapoya College and Research Center, Narendana Todipalli, to introduce Dr. M. Srinivas, Professor and Head of the Department of Pharmacy Practice at Manipal College of Pharmaceutical Science, Manipal, the speaker of this session.
Good morning to all of you. I welcome all the participants and who are gathered here for today's second session happening after the inauguration program. And the speaker for this session is Dr. Srinivas Rajan, the professor from Manipal College of Pharmaceutical Sciences. To introduce, I request Dr. Sripati to give the brief profile about the speaker and welcome all the participants.
Dr. Srinivas Rajan obtained his postgraduate degree from Tamil Nadu Doctor India Medical University, Chennai, and completed his PhD in population pharmacokinetics from Manipal University in 2011. He gained postdoctoral experience at University of North Texas Health Sciences Center, USA, and trained in clinical pharmacy services at the University of Michigan Health System in 2007. He participated in the first summer school in the pharmacometrics at Uppsala University, Sweden in 2010. With over 20 years of teaching experiences since 2001 and a brief industry stint. His expert lies in clinical pharmacokinetics, population pharmacometrics, modeling, and pharmacotherapy. He is the president of the Society of Pharmacometrics and Health Analytics, a board of member of Asian Pharmacometrics Network, and a founder member of the Consortium of Dose Optimization. He has published around 80 peer-reviewed articles and 2 books chapters, serves as a reviewer for national and international journals, and currently mentors serves PhD and 4 formed students. He has secured research funding of 20 million INR from government agencies and industries. He is a professor and head of Department of Pharmacy Practice at Manipal College of Pharmaceutical Sciences, Mahe, Manipal. With this brief introduction, I welcome Dr. Sural Rajan to proceed these presentations. You are welcome, sir.
So the topic of my interest or area of my interest is to talk about the pharmacometrics. So maybe something new. Okay. So pharmacometrics, that's the area of my research for quite some time. Means almost past 20 years or so I'm working in this field, and that's where my interest lies. So probably somewhere in the curriculum, maybe in pharmacy, somewhere mentioned as pharmacy, population pharmacokinetics is the term being used, and the pharmacometrics is the evolution from there. That's where I work. So what is this pharmacometrics or population pharmacokinetics? So when we study about this pharmacokinetics, I'll tell one plus point about this pharmacokinetics. Anybody who works in the clinics is that one area clinicians definitely want the support of pharmacist. Okay, so clinicians may not be comfortable in doing all those calculations, understanding all the pharmacokinetic parameters. Pharmacists definitely can check it in that manner. Inside the hospital, I think no nurses are not able to do that calculations or give a dose, or any other clinicians cannot do. But pharmacists there will be able to do. That's where I am keen and started doing pharmacometrics. So what is this pharmacometrics is like studying and understanding the pharmacokinetics in the population. Because pharmacokinetics is not normally done in patients. Generally, you know, it is done on healthy volunteers. You don't take samples, blood sample from the patients, like 10, 12 samples and do the kinetic studies. Maximum in the patients will take 1 or 2 samples for TDM, right? So now the idea of studying the whole pharmacokinetics from the patients, that's the foundation for this particular science, pharmacometrics, and from where the science has evolved. Don't worry about the slides, I don't even need slides for that. What's pharmacometrics, what we are trying to do is that we wanted to study the pharmacokinetics in patients. When I say patients, what happens? It could be a patient maybe elderly person, you know, typical adult or the patients, and it could be elderly person, or it could be young children. Imagine young children are patients, and pregnant women are patients. Renal hepatic failure condition is that they are also patients now. In those patients, can you study kinetics? Normally you don't do. Okay, so you are changing. Okay, so in those patients, when we do study the kinetics, you need to have an approach where with minimal sample, 1 or 2 blood sample, we should be able to do the kinetics. That is where the whole science of pharmacometrics evolved. Okay, so when I say pharmacokinetic and pharmacodynamic, you know basically what I've done in the pharmacology. We are talking about the pharmacokinetics and pharmacodynamics as the two sides of the same coin. Okay, one which talks about the movement of drug in the body, one which about the therapeutic efficacy. So when you are able to explain both sides of the coin and integrate into your clinics, that's where we will appropriately use this science for clinical development. So the PK, you know the very basic introduction of PK is this: time versus concentration, and PD is concentration versus response. The common denominator in both the cases is your concentration. You remove that and you get time versus concentration. That's what PK-PD model that we will integrate into this pharmacometrics. When you do that kind of integration in the patient's side, bedside, you'll be able to help them to get the optimal dosing. So, pharmacometrics, there are different definitions. So, the whole idea of focus is to understand the pharmacokinetics in the clinical situations, and you will use all this information for your regulatory submissions, and you use this pharmacometric model in the drug development as well as the regulatory decisions and therapeutics in the bedside. In all the places we will be able to use it. Is not that you have this skill on the bedside or not in that. All the places in regulatory submissions, in drug development, and as well as in the patient side. In all these places we will be able to use this knowledge. Okay, by understanding appropriate PK-PD relationships. So what's the whole focus will be on the understanding the variability. Why when you give us a particular dose, the patients are having different concentrations and as well as different pharmacodynamic. What is the reason for this difference? That we are studying in the actual population rather than healthy volunteers. That's the whole purpose. So what's the difference? How we are able to do that? Instead of doing on the left side, you see you have this sample, means you have to take 10-12 sample, control patient, healthy volunteers, and once you have the data, it's easy to analyze. Some of you might have done like AUC, Cmax, Tmax calculation. You can do all that, but that's not possible in patients. So we do it the other way. We take sparse sample, 1 or 2 blood sample, or if possible, you can take this sample, and you can do in small study or a large study, and you can use a different target patient population. As I was mentioning, it could be children, it could be pregnant women, it could be patients with hepatic or renal failure. In all these cases, you can use, but only problem here is the data analysis is not simple. You can't just calculate the parameter. You have to do mathematical modeling. We have to understand the science. Okay, and it actually helps you to explore the variability in the PK-PD component. Both pharmacokinetic and dynamic variability could be explained. So traditional PK studies will look like, which is on the left side, you take one patient, take 12 sample. On the population PK that also sometimes one subject we will take that 1 or 2 sample. Like that you can keep adding more subjects when you get therapeutic drug monitoring data and build a population database and then build your pharmacokinetic model, population PK model. And the focus is done on patient and in special populations. You can have this sample or very sparse 1 or 2 blood samples you will do, and in all the cases of special populations we can use this study approach. Okay, I was mentioning in all the special cases we will use for dose optimization. That's what the whole theme or focus of this particular approach of study. So For example, one example here, vancomycin. So when you have a data which is saying vancomycin clearance is this much, volume of distribution is this much, and using that parameter we build a model or we put inside the model. Using that model and that information, we'll be able to tell for each and every patient based on the covariate data available. We can tell what should be the right dose of vancomycin in the patient. If you measure the drug level and say we use something called Bayesian approach and recommend the right kind of doses to the patients. So how we do that? So you take clinical feature of the patient and dosing history, lab parameter, and all that information will feed with the model-based Bayesian forecasting tool. Once you have this model-based tool, and we are giving that information for optimal dosing recommendations. So that's where I'm saying the pharmacist will play a role, because I'm not anticipating any other group within the hospital to be able to do all these things. Develop model, using that model, use the Bayesian forecasting in anti-cancer and very critical drugs areas, we are able to provide the dosing recommendations. Okay, so the model, when I say some kind of equations like this, which we are studying basic pharmacokinetic only. At the end of the day, all of this equation will give you the specific pharmacokinetic parameter. For example, clearance and volume of central peripheral volume. They are the parameters, right? All these parameters can be driven for each and every individual of the patient. So when you have that kind of amic acid is an example here. When you have amic acid, each one of the patient you have a specific parameter. Use this kind of Bayesian forecasting tool, and with that we will be able to tell what is the right dose for. We are talking about here neonates, just born babies. Just born babies means within 1 month we are talking, right? So in those babies, when we do the study, you can't take like 10 samples. You can take just 1 sample or 2 samples. With that, with this model approach, the example here, the red dots are the observed concentration we observed in the neonates, and the lines, black lines, are the ones which predicted, the model which predicted. So in all of these cases where the model which we developed was able to predict the concentration at those points. That means we are able to tell probably after 10 days also, given the dose, what is the concentration in those babies. Whether it is adequate, whether to increase the dose, all those decisions can be made, and the clinicians were able to apply this one, and we use the Bayesian forecasting to predict. This one of the work of my PhD student. It's a part of our research group in our setting we did that. So antibiotics are very critical, and in that case you have a lot of problems, especially in case of infection and things like that. And we can use all of this model informed precision dosing tools, and you can use individualized therapy. That's the possibility of using these models. And when you look at the softwares, there are a number of tools are available. Autokinetics, these are some examples mentioned. There are 5, 6, 7 tools are there. You can use all those tools to individualize the dosing. Basically, you need some blood level measurement, and then all the information and pharmacokinetic knowledge. We can do all this information. That is where pharmacometrics is applied in clinics. It is not only for efficacy but also to maintain the safety. That's where I want to highlight the role of these tools very specifically, because when you are able to keep the patient within the therapeutic window, you know they are safe. And when the patients are going out of the window slightly high, maybe as the first speaker gave, when you gave lithium and you also gave diclofenac or ibuprofen, that led to reduction in the elimination of lithium leading to toxicity. And if we have a mathematical model, we can use that to predict that kind of toxicity and ensure that safety. Now, these are all different kind of drugs. These are all different classes of drugs I'm mentioning. For all these drugs, we can use this kind of clinical decision-making tools, and they are absolutely useful in the patient setting. So, this one specific case I'm talking about the cardiovascular safety. So, when we look at the different levels of safety issues, one of the prominent toxicity is cardiovascular toxicity. QT prolongation is the one common one. We are you know the normal ECG rhythm, QT prolongation will alter the time differences between the Q and T waves. So, for one drug like moxifloxacin, some of the drugs can cause this delay. Sotalol is a drug which is used to manage this condition. This is where this particular pharmacometric science has been used. So what happened is sotalol is a drug which is used to manage this condition. Imagine in US scenario, this paper they have done. Normally it will take 3 days, at least 3 days to attain this optimal therapeutic benefit. Sotalol case, if you look at that, it takes 3 days or something like that. That means, imagine the patient is coming, taking medication, just what ECG is followed, and then after starting over, they take ECG or become normal, send home. 3 days of hospital admission in a US setting, critical care setting, will cost thousands of dollars. You go and see any of the hospitals in Bangalore, easily you are going to spend anywhere between 30 to 40,000 with 3 days of continuous hospitalization. If we can send a patient on an OPD basis on a single day, you are going to at least cut the cost by 1/3 or 1/4, right? So that's what it was attempted. So by developing PKPD model, they found out the relation between the concentration and the effect. Effect is QTC prolongation. They had a target like that QTC prolongation should be 480 milliseconds. That measured the ACG. That's a target, right? Your QTC should be within that range. Before that means cardiac rhythm problem is there. So they developed this model and they tried different dosage regimens. So where they want to attain the target steady state concentration. If you look at this one, the typical red line did not reach that steady state concentration. The blue line means, look at this is at the end of 24th hour, they are already with the right kind of loading doses and right kind of monitoring, right kind of model, they were able to tell at what doses. We start with 40 milligram IV per hour, then after that 20 mg IV for half an hour, and then another window 20 mg IV half an hour. Then by the end of second day or 24th hour, you switch to oral doses. It's a complicated dosage regimen, but this dosage regimen was recommended based on the modeling. You start with IV dose, then taper the dose. By the end of first day or second day, you reduce the IV dose. By second day almost like within 36 hours, lot of days, you are switching to oral, meaning you can send the patient out very quickly. They are also already in the steady state. We also attain the target, the 430 milliseconds of the pharmacodynamic achievement of the target. So if you look at this way, now you are saying that you are able to make the patient discharge, go home by the end of first day after reaching the therapeutic benefit. Instead of saying 3 or 4 days, that means you are reducing the cost by 1/4. And also safety is ensured because patient is having right amount of cardiovascular rhythm and the dose is also optimized. So that means we are looking at the benefits manifold. One is the efficacy is achieved, target is reached, cost is saved, and all with the benefits of this pharmacometric approach with a clear understanding of the dose response relationship, very specifically in terms of cardiovascular safety here. That's what the whole purpose of explaining in this context I'm trying to say. So that's where this pharmacometrics is being applied. If you look at the curriculum, in many places, it's not there in the curriculum at all. If you ask where is this pharmacometrics, sorry, you are talking, I'm from the master's school only, it is not there in the curriculum. I studied, after studying MPharm, I studied pharmacometrics. It is not there in the syllabus. I just searched outside and started learning pharmacometrics for many years, went here, went outside Singapore, Europe, US, everywhere, and on my own I learned. Now I'm teaching and we are doing research, training the students, conducting the program. I'm also part of the society, as was mentioned during the introduction. There in the society also they are training. And industry needs this. Industry absolutely need pharmacometrics for the drug development program. Okay, and if you ask where are pharmacometrics, there are no pharmacometrics in India. You know something called outsourcing, right? All of you know there's something called outsourcing. Whenever people do research, some activity or IT or pharma or biotech, generally they outsource to India. tariff or something. We don't know what is going to happen. But all the research is outsourced to India. But all the pharmacometric modeling activity of Indian companies is outsourced to America. Even though we are a poor country, but normally poor, but not in pharma. Okay, at pharma we are, the kind of business Indian pharma companies are making. It's much bigger than many of the rest of the world. Only Europe, Japan, US, only 3-4 are above us. Rest of the world is below us. Pharma, we are not poor. So Indian companies will send this work to US and pay 10 crore, 20 crore to do this analysis. Why? Because there are no people to do this analysis. Why? Because it is not there in the syllabus. Syllabus is like somewhere hanging in 16th, 17th century. In the sense, so you don't have to comply. That's what the job of you people. At least somebody has heard this name, what is the pharmacometrics, and you can follow that. Similarly, that's the whole idea of this conference, to give you a flavor of what are the new things you go pursue. I listened to about this topic from Professor D.R. Krishna, one of the senior most professor from Tata University Warangal in the JSS University, JSS College, 2002. One lecture like this I was listening. I heard this topic and then I pursued and followed, and then I did a PhD under it. Because I thought this is most complicated. I'm telling this complicated PKPD within the hospital or in the industry. Nobody else will do other than pharmacists or pharmacometricians. And that's a very niche area. So those who want to take a challenge, you can take the challenge. That's the whole idea of introducing the concept. So in summary, I would say pharmacometrics science incorporate PKPD aspects of drug. It's applicable in drug optimization, in the discovery and development process. Now, we also incorporate AA into this so that the drug, today the Chancellor was talking that drug development process, pro-Chancellor was talking about cost has to be reduced, time has to be reduced. It's already happening. AA has incorporated now in silico medicine, one company brought the drug from hit and target level to the clinical stage in close to 23 months. Normally it will take 5 years, 7 years. They brought it in 23 months, now only probably 2 to 3 years of trial. That means we are going to have the drug within 7 years in the market. You know how long that that patent period? It's 20 years. So you are having 13 years in your pocket. That exclusive drug. You are understanding the outcome of such kind of science. They are also incorporating AI into our analysis components. So this will give an idea about potential areas also. Once you are having the right kind of model, we also do something called clinical trial simulation. Out of all the costs, they will say $2 billion, they are saying $1 billion for your country. I am saying it's 8,000 crore Indian rupees. $2 billion is spent on a drug. That is 16,000 crore rupees is spent on a drug. Out of that 16,000 crore, more than 8 to 10,000 goes on clinical trial phase. So we have something called clinical trial simulation tools nowadays. Without doing a trial, we will, using this PKPD models, we will simulate the trial in silico and see what is the outcome of this trial. So that we know the outcome, at least barely outline of the outcome before even going into the trial. It is like before going to the war, previously they ask some learned all these persons, some religious person, they will say go and ask, based on your stars, you can go to the war. Like that previously king used to ask, like that. Because it is like that only because I spent already 16,000 crore budget, I spent close to half the money. Now next half is most important because number of drugs do fail in clinical trials stage. If we can find out what is the possibility of success, we like pass reasonably, then you can put another 10,000 crore. If you don't want, at least it failed, you can save your 10,000, spend that 10,000 to another new molecule, right? That's the whole idea of companies. They want to shorten the time, reduce the investment, and use these tools to predict the failure. In a drug development, if you are failing, you have to fail early. You should not fail late. Fail before clinical trial stage. Preclinical fail, good, because less money. You don't fail in phase 3 or something. patients who have suffered any adverse effect. So if you want to fail early, otherwise once you pass, you should pass well. So that's the whole idea of drug development, and pharmacometrics is an important component in the drug development, clinical stage, preclinical stage, clinical stage, in the patient, in the bedside, and all the places can be used, and pharmacists can do a great job. Firstly, the science is not available, go search for yourself, that's it. I'm just giving a direction. That's the whole purpose of this particular topic. And thanks for your patient listening, and thank you for the opportunity. Thank you.
Thank you, Dr. Srinivas. I think it is the perfect matching to today's conference, which has innovative practice in clinical training. I think you have done the innovative way of doing the pharmacometrics. And in fact, it's a newer topic, and you have really justified that. And as per my thinking, I think it's a time that the clinicians, as well as the educators, including the regulatory bodies like Pharmaceutical of India, to think that it should be there as a part of the curriculum, especially wherever the pharmacy or the clinical trainings are happening. I think it should be there. And your entire lecture, you have covered about the basics of pharmacokinetics as well as pharmacodynamics, as well as the clinical therapeutics, then Bayesian forecasting, and various tools available to calculate as well as to compile the data. And also, the very much important is the benefits of the study. As we know that in silico method is a newer method taking part in almost all the research, and therefore based upon that we can save the time as well as save the money. And that's how definitely this area is going to take shortly very boom in pharmaceutical industry, especially in the hospital sector. It will take. So thank you for that. And now the session is open for the audience to clarify any doubts, as the resource person is ready to answer your queries.
Yeah, you can ask ChatGPT what question I can ask in the conference like this. See, that is the only thing is the difference between ChatGPT and you. ChatGPT cannot ask question. You can ask question, it will answer, but it cannot ask question. Still, you think the other way, flip the coin and see ChatGPT is so intelligent, it will answer all the questions. Whether ChatGPT will have a question and ask a question. It never asks a question. It cannot think, it cannot see the real world of challenges and something like that. Whether the sweet bun provided in the morning breakfast, is it made of maida or atta? How much it is going to affect today my pharmacokinetics, the therapeutic. So this question, ChatGPT cannot ask. Only you had eaten the sweet one today morning for the breakfast, and you had to medicine, and you had to think about those interactions. So the weird and cranky nature of the humans, as long as you are weird, cranky, asking some questions like that much time only will survive. Once you start asking questions, you are dead. Because ChatGPT what it will do, then it will take its own decisions. The moment the people start asking questions. Okay, fine. Anyway, I'm saying, it's okay. You can always get this question. Look for this particular keyword, Pharmacometrics, Society of Pharmacometrics, in the website and search and keep looking. Somebody is interested. And Manipal University from the Society and NCOPS website, you can reach out to us, and happy to track in the future also.
Thank you, sir. That's what sir mentioned. If at all now the doubt is not there, you can contact the organizing committee members, and definitely will help you to reach out. Now, from my end, you mentioned about the doses, 1 or 2 doses or 1 or 2 samples are enough to calculate that. It depends upon the drug category or disease category, or it's always 1 or 2 samples are enough. That's what I mean.
So how do we do for all the drugs listed in those tools? They have already studied in hundreds of patients. Volunteers, patients, everything, database is there. Now what we do is a Bayesian prediction. So what, when the patient comes, you don't give an error blood sample, anything. Patient comes, doctor has to, with the available data, we can feed the data, saying body weight, gender, all this information. We don't know the blood level. This is what is the dose recommended. From the pre-existing knowledge, it will recommend the first dose. Once the first dose is given, at the end of the first dose, before giving the second dose, take a sample. Take a sample and based on that, it will be able to tell what should be the right dose. Probably one sample, and second day one more sample, you are done very pretty close, will be able to predict. This is called Bayesian prediction. That's what we on these humans have that nature. When I going to the bus stop, you don't know whether bus is coming or not. You have a previous history. Okay, bus will come around 3 o'clock. Then somebody says, sir, 3 o'clock bus is late today. It's 3:50. Okay, 3 o'clock bus is going to come. It's an updated information. Now we are sure you are on 3:10. The bus did not pass. So what happened? You had old information around 3, some percent there. Some should, you have 50% should. Now this person, shop fellow told, sir, the 3 o'clock bus did not pass. Now 3:50 may come. So it's only 3:10. Now what is the probability? Oh, previously I was thinking 60%, 50%. Now with this information, I'm 90% sure, unless the bus breakdown or anything happen, 90% sure that I'm going to catch that 3 o'clock bus now. So now you have used a Bayesian algorithm, update your probability. Now you are more confident to reach the place where you want. Something like this. Bayesian uses this kind of old information plus new information, update the probability until, okay, with this kind of probability, you will be able to give the right doses. That's what Bayesian does. And these are all part of the pharmacometric science, PKPD, Bayesian, statistics and mathematics science. We come together to do this kind of software.
So thank you so much for the clear clarification. On behalf of the organizing committee, we thank the resource person, Dr. Rajan, for wonderful talk. Thank you, sir.
And Dr. Srinivas, who is present at the plenary session. I request Dr. Krishnanand Kamath sir, Professor of Srinivas College of Pharmacy, to present the memento to Dr. Muhammad Gulzar Ahmad and Dr. Srinivas sir. Thank you.
The next session will commence soon after lunch break at 1:30 p.m.
Bangalore is known as an education hub. Many students from different places come to Bangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant and visionary academician, Dr. C. A. Raghavendra Rao started the first educational institution, that is Srinivas College of Hotel Management, in the year 1988. Today, more than 13,000 students are pursuing their higher education at Srinivas University and Srinivas Group of Institutions. Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Srinivas Group of Colleges, Bangalore, is an eminent personality. The university has also recognized his contribution in managing higher education institutions effectively. The group has established many milestones in the quality education in the field of healthcare, medical, dental, paramedical, allied health sciences, hotel management, engineering and technology, physiotherapy, nursing, aviation studies, port shipping and supply chain management. The university has established networking with many industries, universities, and education services providers to substantially improve the quality and weightage of the course and degrees respectively. Presently, Srinivas University has 9 institutes offering innovative industry-oriented specialized courses of UG, PG, and research levels. The Institute of Engineering and Technology is a constituent college under Srinivas University located at Mukka, National Highway 66, Mangalore. The college campus is developed in a lush green environment with well-qualified and experienced faculty, state-of-the-art laboratories and research facilities in the field of engineering, technology and management science as per international standards with the aim of creating technically sound engineers and decision makers who can establish themselves successfully in the industry and global market. Robotics, artificial intelligence and machine learning, cyber security and cyber forensic, data science, cloud technology and information security and blockchain technology and distributed computing. The College of Engineering and Technology is on the threshold of a quantum leap. Institute of Allied Health Science. Srinivas University serves with medical facilities too. The college's clinical requirement is fulfilled by Srinivas Hospital, which is a 700-bedded super speciality hospital. We have separate hostels meant for boys and girls. Srinivas University Institute of Nursing was established in the year 2019 with the commencement of the BSc program under Srinivas University, located at the Srinivas University campus Mukka. The Srinivas Hospital is also located on the same campus and offers an excellent opportunity for students to be trained in a medical college hospital. The courses are well recognized by the concerned nursing councils. The Institute of Management and Commerce, earlier named as Srinivas Institute of Management Studies at Srinivas University, is committed to providing conducive learning environment. Institute of Computer Science and Information Science is envisioned to offer courses which would build the students into enthusiastic quality professionals in the field of computer science and information technology. Since 2005, the college is associated with several MNCs like Infosys Technology, Wipro, IBM, Accenture Technology, TCS, Tech Mahindra, Dia Systems, Spanios Technology, and many other in-placement activities. All-out undergraduate and postgraduate students get good placement through College Placement Program. Institute of Aviation is a constituent of Srinivas University. The college encourages the study of airlines, airports, and business related to the aerospace industry. This also includes supervising routine operations undertaken by the ground staff of an airport or an organization in the aviation sector. Institute of Hotel Management and Tourism offers a Bachelor of Hotel Management and Catering Technology and a BSc Hotel. These programs are focused on the aspect to create professionals who would be the future leaders of the hospitality industry. Practical exposure and experience students will get from working in Hotel Srinivas and Hotel Saffron. Srinivas Institute of Physiotherapy was founded in the year 1993. From the year 2017, the college has become a constituent of Srinivas University. It is the first college which has designed the course curriculum to meet all overseas credentials. The college also has a wide network of alumni spread across the world in various managerial responsibilities. Undergraduate and postgraduate courses in physiotherapy are available on the Pandeshwar campus. Srinivas College of Pharmacy was established in the year 2004, offering both postgraduate, diploma and doctoral courses in pharmacy. The college is located at the VALACHIL campus of the Srinivas Group of Colleges with picturesque surroundings. The Srinivas School of Architecture, established in 2012 with a B.Arch degree under VTU University and is a part of Srinivas Group of Colleges. The school currently offers 5 years B.Arch program, architecture studio, exhibition space, climatology lab, material museum, survey lab, model making studio, specialized classroom and good canteen facility is the highlight of this campus. Srinivas Institute of Technology was established in 2006 with the aim of producing world-class technology graduates tuned to the demands of a fast-changing global village. SIT has gained the name as the best self-financed engineering college in Karnataka in terms of infrastructural facilities. Srinivas Institute of Technology is a unit of Srinivas Group of Colleges, Mangalore. 5 departments have been recognized as research centers by VTU to pursue PhD and MSc. The institute has well-qualified, committed and motivated faculty. is known as an education hub. Many students from different places come to Mangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant and visionary academician, Dr. C. A. Raghavendra Rao started the first educational institution, that is Srinivas College of Hotel Management, in the year 1988. Today, more than 13,000 students are pursuing their higher education at Srinivas University and Srinivas Group of Institutions. Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Srinivas Group of Colleges, Mangalore, is an eminent personality. The university has also recognized his contribution in managing higher education institutions effectively. The group has established many milestones in the quality education in the field of healthcare, medical, dental, paramedical, allied health sciences, hotel management, engineering and technology, physiotherapy, nursing, aviation studies, port shipping and supply chain management. The university has established networking with many industries, universities and education services providers to substantially improve the quality and weightage of the course and degrees respectively. Presently, Srinivas University has 9 institutes offering innovative industry-oriented specialized courses of UG, PG and research levels. The Institute of Engineering and Technology is a constituent college under Srinivas University located at Mukka, National Highway 66, Mangaluru. The college campus is developed in a lush green environment with well-qualified and experienced faculty, state-of-the-art laboratories and research facilities in the field of engineering, technology and management science as per international standards, with the aim of creating technically sound engineers and decision makers who can establish themselves successfully in the industry and global market. Robotics, artificial intelligence and machine learning, cyber security and cyber forensic, data science, cloud technology and information security and blockchain technology and distributed computing. The College of Engineering and Technology is on the threshold of a quantum leap. Institute of Allied Health Science. Srinivas University serves with medical facilities too. The college's clinical requirement is fulfilled by Srinivas Hospital, which is the 700-bedded super speciality hospital. We have separate hostels meant for boys and girls. Srinivas University Institute of Nursing was established in the year 2019 with the commencement of the BSc program under Srinivas University, located at the Srinivas University campus, Mukka. The Srinivas Hospital is also located on the same campus and offers an excellent opportunity for students to be trained in a medical college hospital. The courses are well recognized by the concerned nursing councils. The Institute of Management and Commerce, earlier named as Srinivas Institute of Management Studies at Srinivas University, is committed to providing conducive learning environment. Institute of Computer Science and Information Science is envisioned to offer courses which would build the students into enthusiastic quality professionals in the field of computer science and information technology. Since 2005, The college is associated with several MNCs like Infosys Technology, Wipro, IBM, Accenture Technology, TCS, Tech Mahindra, Dia Systems, Spanios Technology, and many other in-placement activities. All-out undergraduate and postgraduate students get good placement through College Placement Program. Institute of Aviation is a constituent of Srinivas University. The college encourages the study of airlines, airports, and business related to the aerospace industry. This also includes supervising routine operations undertaken by the ground staff of an airport or an organization in the aviation sector. Institute of Hotel Management and Tourism offers a Bachelor of Hotel Management and Catering Technology and a BSc Hotel. These programs are focused on the aspect to create professionals who would be the future leaders of the hospitality industry. Practical exposure and experience students will get from working in Hotel Srinivas and Hotel Saffron. Srinivas Institute of Physiotherapy was founded in the year 1993. From the year 2017, the college has become a constituent of Srinivas University. It is the first college which has designed the course curriculum to meet all overseas credentials. The college also has a wide network of alumni spread across the world in various managerial responsibilities. Undergraduate and postgraduate courses in physiotherapy are available on the Pandeshwar campus. Srinivas College of Pharmacy was established in the year 2004, offering both under, postgraduate, diploma and doctoral courses in pharmacy. The college is located at the VALACHIL campus of the Srinivas Group of Colleges with picturesque surroundings. The Srinivas School of Architecture, established in 2012 with a B.Arch degree under VTU University and is a part of Srinivas Group of Colleges. The school currently offers 5 years B.Arch program, Architecture Studio, Exhibition Space, Climatology Lab, Material Museum, Survey Lab, Model Making Studio, Specialized Classroom, and good canteen facility is the highlight of this campus. Srinivas Institute of Technology was established in 2006 with the aim of producing world-class technology graduates tuned to the demands of a fast-changing global village. SIT has gained the name as the best self-financed engineering college in Karnataka in terms of infrastructural facilities. Srinivas Institute of Technology is a unit of Srinivas Group of Colleges, Mangalore. 5 departments have been recognized as research centers by VTU to pursue PhD and MSc. The institute has well-qualified, committed and motivated faculty. is known as an education hub. Many students from different places come to Mangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant and visionary academician, Dr. C. A. Raghavendra Rao started the first educational institution, that is Srinivas College of Hotel Management, in the year 1988. Today, more than 13,000 students are pursuing their higher education at Srinivas University and Srinivas Group of Institutions. Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Srinivas Group of Colleges, Mangalore, is an eminent personality. The university has also recognized his contribution in managing higher education institutions effectively. The group has established many milestones in the quality education in the field of healthcare, medical, dental, paramedical, allied health sciences, hotel management, engineering and technology, physiotherapy, nursing, aviation studies, port shipping and supply chain management. The university has established networking with many industries, universities, and education services providers to substantially improve the quality and weightage of the course and degrees respectively. Presently, Srinivas University has 9 institutes offering innovative industry-oriented specialized courses of UG, PG, and research levels. The Institute of Engineering and Technology is a constituent college under Srinivas University located at Mukka, National Highway 66, Mangalore. The college campus is developed in a lush green environment with well-qualified and experienced faculty, state-of-the-art laboratories and research facilities in the field of engineering, technology and management science as per international standards, with the aim of creating technically sound engineers and decision makers who can establish themselves successfully in the industry and global market. Robotics, artificial intelligence and machine learning, cyber security and cyber forensic, data science, cloud technology and information security, and blockchain technology and distributed computing. The College of Engineering and Technology is on the threshold of a quantum leap. Institute of Allied Health Science. Srinivas University serves with medical facilities too. The college's clinical requirement is fulfilled by Srinivas Hospital, which is a 700-bedded super speciality hospital. We have separate hostels meant for boys and girls. Srinivas University Institute of Nursing was established in the year 2019 with the commencement of the BSc program under Srinivas University, located at the Srinivas University campus, Mukka. The Srinivas Hospital is also located on the same campus and offers an excellent opportunity for students to be trained in a medical college hospital. The courses are well recognized by the concerned nursing councils. The Institute of Management and Commerce, earlier named as Srinivas Institute of Management Studies at Srinivas University, is committed to providing conducive learning environment. Institute of Computer Science and Information Science is envisioned to offer courses which would build the students into enthusiastic quality professionals in the field of computer science and information technology. Since 2005, The college is associated with several MNCs like Infosys Technology, Wipro, IBM, Accenture Technology, TCS, Tech Mahindra, Dia Systems, Spanios Technology, and many other in-placement activities. All-out undergraduate and postgraduate students get good placement through College Placement Program. Institute of Aviation is a constituent of Srinivas University. The college encourages the study of airlines, airports, and business related to the aerospace industry. This also includes supervising routine operations undertaken by the ground staff of an airport or an organization in the aviation sector. Institute of Hotel Management and Tourism offers a Bachelor of Hotel Management and Catering Technology and a BSc Hotel. These programs are focused on the aspect to create professionals who would be the future leaders of the hospitality industry. Practical exposure and experienced students will get from working in Hotel Srinivas and Hotel Saffron. Srinivas Institute of Physiotherapy was founded in the year 1993. From the year 2017, the college has become a constituent of Srinivas University. It is the first college which has designed the course curriculum to meet all overseas credentials. The college also has a wide network of alumni spread across the world in various managerial responsibilities. Undergraduate and postgraduate courses in physiotherapy are available on the Pandeshwar campus. Srinivas College of Pharmacy was established in the year 2004, offering both postgraduate, diploma and doctoral courses in pharmacy. The college is located at the VALACHIL campus of the Srinivas Group of Colleges with picturesque surroundings. The Srinivas School of Architecture, established in 2012 with a B.Arch degree under VTU University and is a part of Srinivas Group of Colleges. The school currently offers 5 years B.Arch program, Architecture Studio, Exhibition Space, Climatology Lab, Material Museum, Survey Lab, Model Making Studio, Specialized Classroom, and good canteen facility is the highlight of this campus. Srinivas Institute of Technology was established in 2006 with the aim of producing world-class technology graduates tuned to the demands of a fast-changing global village. SIT has gained the name as the best self-financed engineering college in Karnataka in terms of infrastructural facilities. Srinivas Institute of Technology is a unit of Srinivas Group of Colleges, Bangalore. 5 departments have been recognized as research centers by VTU to pursue PhD and MSc. The institute has well-qualified, committed and motivated faculty. Bangalore is known as an education hub. Many students from different places come to Bangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas Group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant and visionary academician, Dr. C. A. Raghavendra Rao started the first educational institution, that is Srinivas College of Hotel Management, in the year 1988. Today, more than 13,000 students are pursuing their higher education at Srinivas University and Srinivas Group of Institutions. Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Srinivas Group of Colleges, Mangalore, is an eminent personality. The university has also recognized his contribution in managing higher education institutions effectively. The group has established many milestones in the quality education in the field of healthcare, medical, dental, paramedical, allied health sciences, hotel management, engineering and technology, physiotherapy, nursing, aviation studies, port shipping and supply chain management. The university has established networking with many industries, universities, and education services providers to substantially improve the quality and weightage of the course and degrees respectively. Presently, Srinivas University has 9 institutes offering innovative industry-oriented specialized courses of UG, PG, and research levels. The Institute of Engineering and Technology is a constituent college under Srinivas University located at Mukka, National Highway 66, Mangalore. The college campus is developed in a lush green environment with well-qualified and experienced faculty, state-of-the-art laboratories and research facilities in the field of engineering, technology and management science as per international standards, with the aim of creating technically sound engineers and decision makers who can establish themselves successfully in the industry and global market. Robotics, artificial intelligence and machine learning, cyber security and cyber forensic, data science, cloud technology and information security, and blockchain technology and distributed computing. The College of Engineering and Technology is on the threshold of a quantum leap. Institute of Allied Health Science. Srinivas University serves with medical facilities too. The college's clinical requirement is fulfilled by Srinivas Hospital, which is a 700-bedded super specialty hospital. We have separate hostels meant for boys and girls. Srinivas University Institute of Nursing was established in the year 2019 with the commencement of the BSc program under Srinivas University, located at the Srinivas University campus, Mukka. The Srinivas Hospital is also located on the same campus and offers an excellent opportunity for students to be trained in a medical college hospital. The courses are well recognized by the concerned nursing councils. The Institute of Management and Commerce, earlier named as Srinivas Institute of Management Studies at Srinivas University, is committed to providing conducive learning environment. Institute of Computer Science and Information Science is envisioned to offer courses which would build the students into enthusiastic quality professionals in the field of computer science and information technology. Since 2005, the college is associated with several MNCs like Infosys Technology, Wipro, IBM, Accenture Technology, TCS, Tech Mahindra, Dia Systems, Spanios Technology, and many other in-placement activities. All-out undergraduate and postgraduate students get good placement through College Placement Program. Institute of Aviation is a constituent of Srinivas University. The college encourages the study of airlines, airports, and business related to the aerospace industry. This also includes supervising routine operations undertaken by the ground staff of an airport or an organization in the aviation sector. Institute of Hotel Management and Tourism offers a Bachelor of Hotel Management and Catering Technology and a BSc Hotel. These programs are focused on the aspect to create professionals who would be the future leaders of the hospitality industry. Practical exposure and experience students will get from working in Hotel Srinivas and Hotel Saffron. Srinivas Institute of Physiotherapy was founded in the year 1993. From the year 2017, the college has become a constituent of Srinivas University. It is the first college which has designed the course curriculum to meet all overseas credentials. The college also has a wide network of alumni spread across the world in various managerial responsibilities. Undergraduate and postgraduate courses in physiotherapy are available on the Pandeshwar campus. Srinivas College of Pharmacy was established in the year 2004, offering both under, postgraduate, diploma and doctoral courses in pharmacy. The college is located at the VALACHIL campus of the Srinivas Group of Colleges with picturesque surroundings. The Srinivas School of Architecture, established in 2012 with a B.Arch degree under VTU University and is a part of Srinivas Group of Colleges. The school currently offers 5 years B.Arch program, architecture studio, exhibition space, climatology lab, material museum, survey lab, model making studio, specialized classroom and good canteen facility is the highlight of this campus. Srinivas Institute of Technology was established in 2006 with the aim of producing world-class technology graduates tuned to the demands of a fast-changing global village. SIT has gained the name as the best self-financed engineering college in Karnataka in terms of infrastructural facilities. Srinivas Institute of Technology is a unit of Srinivas Group of Colleges, Mangalore. 5 departments have been recognized as research centers by VTU to pursue PhD and MSc. The institute has well-qualified, committed and motivated faculty. is known as an education hub. Many students from different places come to Mangalore just for study purposes. So just take a round around a famous private research and skill-focused university, that is Srinivas University. Srinivas University is the flagship of the 18 Srinivas group of institutions started by the A. Shamrao Foundation. It is a private charitable trust founded in 1988 by an eminent chartered accountant, Dr. A. Raghavendra Rao. Proud son of Atka Shamrao, renowned chartered accountant and visionary academician, Dr. C. A. Raghavendra Rao started the first educational institution, that is Srinivas College of Hotel Management, in the year 1988. Today, more than 13,000 students are pursuing their higher education at Srinivas University and Srinivas Group of Institutions. Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Srinivas Group of Colleges, Mangalore, is an eminent personality. The university has also recognized his contribution in managing higher education institutions effectively. The group has established many milestones in the quality education in the field of healthcare, medical, dental, paramedical, allied health sciences, hotel management, engineering and technology, physiotherapy, nursing, aviation studies, port shipping and supply chain management. The university has established networking with many industries, universities, and education services providers to substantially improve the quality and weightage of the course and degrees respectively. Presently, Srinivas University has 9 institutes offering innovative industry-oriented specialized courses of UG, PG, and research levels. The Institute of Engineering and Technology is a constituent college under Srinivas University located at Mukka, National Highway 66, Mangaluru. The college campus is developed in a lush green environment with well-qualified and experienced faculty, state-of-the-art laboratories and research facilities in the field of engineering, technology and management science as per international standards, with the aim of creating technically sound engineers and decision makers who can establish themselves successfully in the industry and global market. Robotics, artificial intelligence and machine learning, cyber security and cyber forensic, data science, cloud technology and information security, and blockchain technology and distributed computing. The College of Engineering and Technology is on the threshold of a quantum leap. Institute of Allied Health Science. Srinivas University serves with medical facilities too. The college's clinical requirement is fulfilled by Srinivas Hospital, which is a 700-bedded super specialty hospital. We have separate hostels meant for boys and girls. Srinivas University Institute of Nursing was established in the year 2019 with the commencement of the BSc program under Srinivas University, located at the Srinivas University campus, Mukka. The Srinivas Hospital is also located on the same campus and offers an excellent opportunity for students to be trained in a medical college hospital. The courses are well recognized by the concerned nursing councils. The Institute of Management and Commerce, earlier named as Srinivas Institute of Management Studies at Srinivas University, is committed to providing conducive learning environment. Institute of Computer Science and Information Science is envisioned to offer courses which would build the students into enthusiastic quality professionals in the field of computer science and information technology. Since 2005, The college is associated with several MNCs like Infosys Technology, Wipro, IBM, Accenture Technology, TCS, Tech Mahindra, Dia Systems, Spanios Technology, and many other in-placement activities. All-out undergraduate and postgraduate students get good placement through College Placement Program. Institute of Aviation is a constituent of Srinivas University. The college encourages the study of airlines, airports, and business related to the aerospace industry. This also includes supervising routine operations undertaken by the ground staff of an airport or an organization in the aviation sector. Institute of Hotel Management and Tourism offers a Bachelor of Hotel Management and Catering Technology and a BSc Hotel. These programs are focused on the aspect to create professionals who would be the future leaders of the hospitality industry. Practical exposure and experienced students will get from working in Hotel Srinivas and Hotel Saffron. Srinivas Institute of Physiotherapy was founded in the year 1993. From the year 2017, the college has become a constituent of Srinivas University. It is the first college which has designed the course curriculum to meet all overseas credentials.
Good afternoon, everybody. Had your lunch? Going to get sleep? No. Now we have a great session by Dr. Prashant Chandra. It's happy to introduce Dr. Prashant Chandra in this session. He earned his B.Pharm and PharmD from the Tamil Nadu Dr. NGR Medical University, Chennai, in the year of 2007 and 2013, and he has completed his Doctor of Pharmacy from Manipal Academy of Higher Education, Manipal, and ICMR SRF program in the year 2023, and he also earned his MS in Consciousness Studies from Bhakti Vandana Institute, Mumbai, which is affiliated with BETS Pilani, and he has more than a year experience in hospital pharmacist at Puja Hospital, Mumbai. His area of interest are neurosciences, infectious diseases, and data analysis. And he has more than 6 years of teaching and research experience. And he has published various book chapters and manuscripts preparations and reviewer in various national and international peer-reviewed journals. And he also having 2 patents in his credits. And he is currently employed as an assistant professor in the Department of Pharmacy Practice at Amrita School of Pharmacy, Kochi, Kerala. With this brief introduction, I am inviting Dr. Prashant Chandra to this stadium, and the session is yours, sir.
Thank you for this introduction, ma'am. As you were mentioning, it's a high time for the students to sleep also, but I request the students to just open your mind. Although your eyes might be closed, because you are going to learn certain things from this presentation, what are the initiatives taken by the Indian government in mitigating or containing or preventing the future pandemics. With that, I'll start. And I would like to thank the organization, especially the principal of this organization, and Pooja. She is actually my PhD mate. So I would like to thank her also for giving me this opportunity to stand on this platform and delivering this talk. Thank you. Yes, so as we all have witnessed, COVID-19, which is considered to be as one of the worst human health crises in the humanity or in the life of humanity. It's not that COVID is the first one, the pandemic has happened previously also, but it is a novel pathogen. That's why we were worried about this pandemic. So, it took us a while for us to understand that how this pandemic has impacted the life, the livelihood, and the economy of our country. Now, I'm just focusing on India, although this COVID pandemic has affected the whole globe actually, but I will be focusing on India, what the Indian government has did to contain this pandemic, and what are the future, what are the learnings they have obtained from the past pandemics, and whether they are going to implement the novel, innovative ideas for preventing the future pandemics. Yeah. So, we have collectively fought this pandemic using strong surveillance, and we have manufactured many drugs, therapeutics and vaccines for mitigating this COVID-19. But although it came late, so there was a research done from the Global Health Organization, especially from IPPR, that if you start your analysis from the day zero, if any future pandemic comes, if you start your analysis or if you start your countermeasures from day zero, you will be successfully eradicating any future pandemics within the 100 day. That is called as 100-day mission. So this is also one of the learning from the global side to India. So yes, so do you think that COVID-19 is the last pandemic? Of course not. I will give you an example. See, as long as we have an interaction, the human have an interaction with animals and plants, we will definitely have future pandemics. I'll give you an example. I don't know whether you may are aware of this incident. During 1992 till 2007, the vulture population declined and the rabies cases increased. Now, what was the reason behind it? See, you know that a live cow produces some 300 milligrams of methane, which is a greenhouse gas, potential very toxic greenhouse gas, and which can have an effect on climatic change. So, a live cow can produce 300 mg of methane per day. However, when we slaughter that cow, it's not that a diet cow will produce methane. The cells or that the waste dead carcasses can produce almost the same amount of methane that a live cow can produce. See, our ecology has a good balancing system. If a live cow can produce 300 mg of methane, the forest trees can neutralize it, nullify it. But if you want to kill a cow, you need an animal husbandry. You need a big industry where you cut the forest, isn't it? So what will happen? When you throw out these dead carcasses, the methane is produced, or in addition to the alive cow methane, there is no trees that will nullify this methane. So what has happened? The dead carcasses were fed by the vulture. Now vulture started dying. Why? Because these cows were already fed with diclofenac sodium, which is a renal failure drug, because its side effect is renal toxicity. Now, because of this, the vulture started dying because of renal failure. So vulture population declined over 15 years. Now what has happened? This dead carcasses were fed by stray dogs. So this dead carcasses which were infected were consumed by the dead dogs, and they started biting the humans, and thereby rabies were increased. So this is just an example of human, plant, animal interaction. If you try to disturb the ecological balance, definitely a future pandemic is inevitable. Okay, so as for the WHO, it is said that 75% of the infection are zoonotic. You take any example, even COVID. It was, when the COVID pandemic started, it was said that it came from bats. Even Zika virus. You take the example of Zika virus. It came from rhesus monkey. You take HIV. Came from rhesus monkey. You take an example of Nipah virus recently, an outbreak in Kerala, Kozhikode district. So that also came from bats. So you take the example of any virus that have a zoonotic origin. So, and even WHO has also identified some 30 families of bacteria and virus which have a potential to cause future pandemics. Okay, so how the Indian government or our nation has planned to mitigate this future pandemic? So definitely, as I have told you that it took a long process for us to develop certain infrastructures, resources to mitigate pandemic. Now, they want to fasten up this process by analyzing what has happened previously. So they have set up one expert group, which is done by the NITI Aayog, the member of secretary. So you may be aware of this NITI, National Institute for Training Institute, which is initiated by the Indian government. So they have set up one expert group. And the role of them is to learn from the previous experiences and develop detailed analysis of what worked and what did not work during the management of COVID-19. So they have been given with some tasks, terms of references. So they have to first focus on gathering information on the potential pathogens. That means whether it is contagious or not. What about the variants? Because you might have heard about this in various newspapers that during the COVID period that this variant has arisen, that variant has arisen. So that thing they have been given a task to study. Okay, then suggest a mechanism for surveillance also. Now, for example, if any crime is done, so how the police will come and identify using some CCTV surveillance. So these are certain mechanisms how to identify a criminal and put it in jail. So similarly, they have to suggest or recommend certain surveillance and mechanism for surveillance. Now, in this case, see, in COVID, why we took a lot of time is because we had only one national portal that is called IDSP, that is Integrated Disease Surveillance Program. Now, this is like a software where from anywhere you can send the data to this data software, and they will sit and analyze and do the research. But however, like this is present in Delhi, this IDSP software is present in Delhi, but the person who is, if any pandemic happens in Kerala, for example, Kerala or Karnataka, you don't have any means to transmit this information to IDSP software. So that was one biggest problem or challenge with us. Then later on, they identified this problem, and now we have call centers given by NCDC, National Center for Disease Control and Prevention. We have call centers. So any risk happens, we can immediately, enter the data to the software, and that will be reached to the main hub, that is called as IDSP. So this is called as spoke and hub method. So anywhere the data can be fed, and that will be reaching to the main hub, that is in Delhi. Okay. So, but these all took time actually. So that's what they have been appointed for, to learn from the previous experiences. Okay. Then they have to recommend specific action for strengthening the pandemic prediction. See, unless you have a data, you can't predict anything. Now, maybe after 1 year, 2 years, next pandemic may be expected, but how you will expect that? Because of the previous data. So in the previous session, Dr. Srinivas Rajan was mentioning that regarding the Bayesian model. So when you have a previous data, you upload that, then only you will get the next data. Then only you will get updated. That is called Bayesian framework. So similarly, you should have the data. And during COVID time in India, we had lack of data, dearth of data. So we have to, in order to predict any future pandemics, you should have the data. Then, based on that data only, you will find new drugs, vaccines, therapeutics. And similarly, they have to get, and another problem was, see, you might have heard about rapid antigen test approved by the ICMR. See, in the beginning, we didn't have too much of a rapid antigen test with us. So what the ICMR has done is, they had made a partnership with the private institutions. Just remember, even in the case of masks, sanitizers, even in the case of this, what is that called as, vaccines. So what they have done, they have collaborated with the private institutes such as Bharat Biotech, Serum Institute of India, and they have bulk manufacturing they did actually. So this is how that private-public partnership, PPP, was also lacking. But they slowly learned from their previous experiences, and this is one of the way to mitigate the future pandemics by learning from the previous experiences. So these are the tasks of reference given by the Niti Aayog to the expert committee group. Now, how the expert committee group will come into action? They have to first consult from the national as well as from the international experts such as public health people. See, COVID-19 was a public health disease. So in order to show any response against this public health disease, you should have people from the public health also. So they have taken expertise from the public health, then medical doctors, epidemiologists, academicians, and various other government senior officials from center and state level. Finally, they have presented this, their research to the Niti Aayog, because they are the one who has appointed this expert group. So they have presented this to the Niti Aayog, and there they recommended few things. One is legislation, another one is governance, and the third one is giving more or generating more funds for developing therapeutics, diagnostics, and vaccines. Now these three were lacking actually. So now the Indian government has agreed with this. So now they are going to produce more amount of diagnostics techniques and vaccines, diagnostic techniques, vaccines, and other therapeutic countermeasures in the future for mitigating any future pandemics. Now before that, just go through the history. So this is just a 2 decades back, 20 years back data I have collected. See, in 2003, SARS came, and look at the impact of the SARS on the whole globe.
SARS outbreak was there in 2003, there was no international legal binding regulations or rules. For example, when the SARS outbreak was there, see, people can freely move from here and there. There was no quarantine, there was no, the containment policies, and that idea was not there at that time because at that time science was not developed at that time. But when slowly when few new novel pathogens came, so our science evolved because of our human brain evolved. So that's how we used to put up new ideas to prevent or mitigate the future pandemics. Now this is one of the best examples to understand how our science evolved. Now there was no legally binding rules. Then novel pathogens, at that time PCR and all, to imagine that PCR in India is very difficult. That was a big challenge for us. So how to identify new pathogens and whether there is any variants or not, that also we don't know. Third thing, the core capacities. Core capacities means, this highly skilled public health doctors, nurses, those were also not there. Now, if you see, in the 2005, the avian flu, which is nothing but bird flu, okay, that outbreak happened even in the 2024. But you see, there was a slight improvement in the process. For example, surveillance was started in the 2005 in all the animals. Okay? Then you see H1N1 pandemic. You are very well aware of this outbreak in 2009, H1N1, where all the advantages or the challenges, disadvantages or the challenges which were there in SARS 2003 that were fulfilled in 2005. See, IHR, International Health Regulation, came at that time. That means if you want to move from this country to that country, you should be producing some vaccine certificates. Okay, this started in 2005 actually. Then in airport, quarantine facilities were there. At that time, doctors were highly skilled, and even the science was evolved that in certain hospitals they were having PCR machines also. So that as years passed, science evolved because of human brain development. Okay, so now you see Ebola virus outbreaks. Similarly, MERS. This was in 2012 from the Middle East. Now it's Zika virus. Okay, now I don't know how many of you are aware of the Zika virus. Even in Karnataka, the Zika virus outbreak was there in Shivamoga, few places there was an outbreak of Zika virus. But they managed it wonderfully. It was a remarkable management right now. Why? Because it was again the learning from the previous experiences. Right now, Zika virus, no trace is there. Even, I'll give you an example of another in Kozhikode. I'm not, many of them may not be aware of Kozhikode, the term. Why? Because it is also known as Calicut, because the WHO uses this term, Kozhikode, in their website. That's right. And in that, it was, in case of Nipah virus, the whole area was, declared as containment zone, red zone. So immediately what they did, the state government has strengthened their surveillance. They didn't allow any public events, they didn't allow any movement of people from here to there, and they also have call centers. This was not there during the COVID pandemic time. Because that's the reason, if any variance occurs in other regions, you may not know, and that may not be, that information may not be sent to the IDSP, because using IDSP you can do the research. Okay, so this is what the learning and the challenges that expert group has thrown into. So first is governance. So governance, see, as I told you, you have a risk assessment system, but you don't know what to do with that. There is two kinds of risk assessment system. One is swift assessment system, another one is comprehended assessment system. So in this swift assessment system, see, suddenly an outbreak comes, you don't know what to do, so suddenly you should, immediately you declare a containment zone, you declare, nobody should arrange any public events. So that is called a swift assessment.
So during this SWIFT assessment, you try to study what kind of pathogen is this, how it affects, what kind of symptoms it arises, and how can we mitigate, is there any time to produce any drugs, vaccines, therapeutics against this. So that takes time. So that assessment is called as comprehension assessment. Okay. So it requires community engagement also. So why community engagement? See, you remember a case of 2019 where Shaheen Bagh protests were there in New Delhi, and suddenly when they came, when they were come to know about this COVID-19, they all vanished from that place. So that is called community engagement. And few people, you know, like a responsible person, being an Indian citizen, a responsible citizen, we also know that if we get any a pandemic infection, what we will do, we will isolate ourselves. We will get quarantined. So that is called as responsible community engagement. Okay, so at that time, if an area has been quarantined, if any new variant has been identified, there was no risk assessment, first of all, and even though if there is a risk assessment, you cannot communicate that to the higher level, as in case of I explained to you about that IDSP software. Second, lack of well-defined rapid response SOPs that empower key officials to act immediately. Now, see, now I won't, it's not a mistake. However, if something happens here and you want an action immediately, so what you will do? You will call the higher officials. Now, higher officials may not have the authority to deal with that. What they will do, they will call the higher officials. So there is a multi-level hierarchical process you have to go through to get one solution. So that was there at that time. Now, what this expert group has recommended to give in this EGOS system, that is Empowered Governing System. What does that mean? See, this was started actually under the scheme of Pradhan Mantri Gati Shakti Yojana. Now, what it is basically related to rail, road transportation, where you can transport the logistics very easily. Now, you see this rapid antigen testing. It was produced from Pune. Now, the next day itself, it is available in your place or in Kerala. How? Because of this Gati Shakti Yojana. So that this has to be tackled by Empowered Governing System. Okay. Now, again, legislation. Now, we don't have a proper legislation. I don't know whether you are aware of this. We have currently two legislations. One is EDA, Epidemic Disease Act. Okay. Another one is National Disaster Management Act. And COVID was put under National Disaster Management Act. But these two acts does not suit for the modern approach of treatment. For example, see, National Disaster Management Act means if any disaster occurred by humans, for example, like nuclear reactor incidents, such things, and natural means floods, earthquakes. So there is no relationship between an infectious disease and a disaster. But however, they don't have, at that time, they didn't have any right Public Health Act management system. So that's why they have, declared that they have kept this under NDMA. Now, another thing is Epidemic Disease Act. Now, Epidemic Disease Act, it also lacks. This is an oldest act. And by the way, I'll remind you one more thing, that NDMA Act was enforced during tsunami in 2004. And Epidemic Act is in somewhere around 1918, I think. So I'm not sure about that. You can just check it through Google. So they requested or recommended for another act called as Public Health Emergency Act, where any pandemic outbreaks come, they have to enforce this FEMA Act, that is Public Health Emergency Act. So in case of Epidemic Disease Act, there was no provision for dissemination of vaccines. If something happens, if you enforce that act, that government will say that, okay, from today onwards, you have to do whatever we say. Now, there is only authority. Now, they will not take care of the rights of a citizen. So that is the problem with Epidemic Disease Act. But they are recommending that even you should, be mindful of rights of the citizen also. Even this Epidemic Disease Act does not contain any information about how to disseminate the vaccines, how to provide therapeutics, or how to provide containment zones. Those information does not, this Epidemic Disease Act does not give. So next is surveillance and data management. Now this is another important thing that must be there, or that it is a major important factor for the mitigation of future pandemic, because as I told you, surveillance was very weak. Now they have started a very good surveillance. For example, see, as I have already told you that we had IDSP, and there is another portal called as IHIP, Integrated Health Information Portal. We have two portals, but it is not centralized actually. Not in every district hospitals or not in every state we have. We have only information at the national, national in the sense in the New Delhi. So they were saying, they were recommending that this portal should be there in each and every state, including each and every districts. So this is called as spoke and hub method. Okay, so there was no seamless flow of data because of lack of this software. So they want some unified national data portal. Now, if you remember that we had Arogya Setu app developed by the Indian government. So why that has been developed? Just to fulfill the gap. So if you download that app, you can have contact tracing. Wherever you travel, this app will tell you that you have traveled from this area to that area. So that area might be affected with that COVID or any future outbreaks. And when you come back, the government will tell you, since you have come back, because all these data are stored in IDSP. So they will tell you that since you have come back, you just get quarantined. So that was the initiative taken by the Indian government to mitigate the future outbreaks. Then another thing is, National Animal Disease Expert System, Referral Expert System. So this is only for animal challenge facilities. Now we have only few animal challenge facilities. For example, see anything, since I have told you all the outbreaks are related to future pandemics. So, all the outbreaks are related to zoonotic disease, as 75% of the pathogens are originating from the animals. So they have this facility also, where you can send the samples, they will check it, and they will tell that this animal has to undergo that treatment. Similarly, we have lack of INSACOG network. Now, INSACOG network is nothing but if you find, if in any place, if there is a variant circulating, immediately you can send a sample to that, and they have the facility to identify whether that circulating variant has mutation or not. That were also not there previously, but now we have INSACOG labs also, even in every district level. Yes, as I have told you, we are lacking with public-private partnership models, such as I have told you, we had rapid antigen test kit developed, which is home-based self-rapid antigen test, and we don't have validation, we don't have methods to validate it. So ICMR has partnered with Merrill company, I don't know whether you know or not, and there is one more kit called as TrueNat. I don't recall which company is that, but there was one home-based self-diagnostic kit, TrueNat, where it was first designed for detecting multi-resistant TB. Now they have also started using for diagnosing COVID-19 also. So validation technique were not there. Then ICMR's rapid low-cost test for bulk manufacturing. So it requires public-private partnership because ICMR has not having enough fund to go for bulk manufacturing. So they have, Serum Institute of India, Bharat Biotech, they have collaborated with them, and then finally they have gone for bulk manufacturing of vaccines. Similarly, there is uninterrupted supply chains of cost-effective PPEs and sanitizers. So once upon a time, you remember that there were lack of masks. The PPEs were not there, even hand sanitizers were not there. So in order to
have this in huge quantities, you should have a public-private partnerships. Then, we don't have funds, and during the COVID period, you might have heard about that, the government is going for taking some blood sample from the already affected COVID-19 patient, and they will be administering this to the weak immune people. That is called as convalescent plasma. But for that, Maharashtra government has provided some 16 crore. Failed. It says that it failed, but in few cases it passed. But still, we don't have some high risk funding were not there at that time. But at that time, this in order to extract this blood from the patients, those who have strong immune system, even certain colleges came forward to give that plasma analyzer machine actually, apheresis machine. So then again, Mission COVID Suraksha. Again, I have told you guys, many of the companies, private companies came forward to develop certain vaccines. Zycovid-D, Gemcovac, Incovac. Now I don't know how many of you are aware of this. Incovac is one more thing. We are the first one to develop all the COVID vaccines. Even if it is DNA vaccine, that is Zycovid. We are the one who developed this. Second, Gemcovac. It is an mRNA mRNA vaccine. Again, this is an Incovac. Incovac is a nasal vaccine. All the vaccines, we were the first one to develop. We are proud. We should be proud of that, actually. Similarly, we had challenging easy access of to animal challenge facilities. As I told you that if animals were infected, then we cannot go there and collect the sample and do the research on that. Why? Because we don't have a memorandum of understanding or material transfer agreement. At that time, we didn't have all these things. That's why we failed to realize the infected animals priorly. Second thing, BSL-3. Now, this is Biosafety Lab 3. We are lacking Biosafety Lab 3, and I don't know how many of you know that. Currently, we have one mobile BSL-3 lab which was developed in Pune by the Indian government using Atmanirbhar effort. So that BSL Lab 3 was, since it is a mobile, it's a bus actually, so all the facilities will be there inside the bus. So that bus was taken or driven to Kerala to analyze the Nipah samples actually. So this is how we are developing in order to mitigate the future pandemics. Okay. Then certain regulatory reforms are also needed, but I don't know how countries will respond. Other countries internationally, how other countries will respond with that, because there is in other countries they may have approved some drugs or vaccines, but in order to import that drug to our country, we need to have lot of discussions, lot of memorandum of understanding. So that is one of the reasons it took a lot of time. Now you have heard about remdesivir, which was a drug produced by Gilead. It was used in India, but along with that, there is one more drug called bartenicib. This is one drug which is a monoclonal antibody, and research has said that combination of bartenicib plus remdesivir is much more effective than remdesivir alone. So now the Indian government has to import that drug from other countries. Now it may take a lot of time. By the time you may have patients dying in India. And if you just visit the MOHFW, that is Ministry of Health and Family Welfare website, you will find in the COVID related information that currently there are 6 patients still with active COVID. Now, you may be thinking that COVID, some quarter, decade back, it vanished, but not. Still 6 patients are there who are affected with COVID, and some 4 crore people have been, came out of this COVID infection, and there were 5 lakh people who died because of this COVID. You can just, Google it. And there were no well-established, globally accepted clinical trial site network. So, if the some other country. So that in order to bring that, so import is one problem. Again, even though if you import it, then you don't have, clinical trial site. Internationally, recognized clinical trial site you don't have in India. But right now, you have, I don't know how many of you are aware of this THISTI, THISTI. That is Translational Health and Science Technology Institute, which is in Faridabad, which has collaborated with CEPA, that is a global organization, Coalition for Emergency Preparedness and Innovation. So that is CEPI always works on production of biotechnological works. Now THISTI has collaborated. This is now only 7 such organizations among the world are there who has collaborated with CEPI. And one among the world is us, that is THISTI. That institute has collaborated, and now they are working on, like beta coronavirus infections. So in future, if any pandemic occurs, so this THISTI institute will collaborate and find and come up with new vaccines. This is what our hope is. So these are the key recommendations, as I have already discussed, that governance should be improved, then legislation that act regarding it, then finance and management, then surveillance should be strengthened, data management should be proper so that we can have early prediction and warning should be given to the public. And modeling, and one more thing regarding modeling, since it is a mathematical term, we don't have, currently, as of now, during the COVID time at least, we don't have a human resource who knows or well about this machine learning algorithms. So currently if we want to predict any infections, we use machine learning algorithms. But at that time, there were no expert persons who know how to operate this machine learning. So now we have, currently surpassed that challenge also. So similarly, research, innovation, manufacturing, infrastructures, and capacity building. Capacity building in the sense, we have now currently a lot of healthcare professionals out there who are expertise in collecting the samples, sending it to the BSL 3 or BSL 4 labs, and there are certain, in BSL 3 and BSL 4, we have certain faculties or staffs who are equipped with well-developed machineries who can identify and also identify the like genetic mutations within the pathogens. Similarly, risk communication, then community engagement, private sector partnerships and international collaborations will also improve. So these are the key recommendations given by the expert group to the NITI Aayog. And as I have mentioned, 100-day mission, this was actually done by IPPRS, International Panel for Pandemic Preparedness and Resilience Secretariat in 2021. They have given this, after a lot of studies they have done, and they found out that if we start at day 0, if you put an effort to mitigate the pandemic at day 0, it is sure that by 100th day, we can have completely eradicated this COVID-19. I mean like future pandemics, not COVID-19, it's future pandemic. So I think I have done with my job. So if you have any questions, please. So and I just want to mention one mathematical term which I forgot. I don't know how many of you are aware of R naught. R naught. That indicates, if R naught is 1, that indicates that you have if you are infected, and the study says that R naught in that area, that means you have a potentiality to spread that infection to at least one person. I'll give you an example. In case of swine flu, okay, swine flu, which was in 2003, somewhere around 2003, the outbreak was happened. The R naught was 2 to 3. That means there is a potentiality that you will transfer, or one person can transfer this flu virus to at least, on an average, 2 to 3%. But when it again happened in 2009, see 2003 and 2009. The R naught was 1 to 2. So it reduced. Why? Because of the previous challenges they have experienced and they have learned from it. That's why, you have in 2009 you have drugs therapeutics, vaccines to mitigate that. That's the reason from R0 2 to 3 came down to 1 to 2. So I hope that India is still, the surveillance is still weak, because in all the rural areas you don't have labs. So, but still India can manage a future pandemic outbreaks if it happens. Thank you.
Thank you for your informative presentation, Dr. Prashant Chandra. Actually, this session was simply, we can't say this is informative. Really, it is an opening session. The thing was where we were lagging and what we have to do in future to overcome the pandemic situation. It was what we have discussed. Really, if you follow being a healthcare people, if you follow those things and creating awareness among the healthcare sectors and the public sectors and other community means, definitely it is possible to overcome this kind of pandemic situation. Thanks for your appreciation.
Thank you, ma'am.
And I wholeheartedly express my gratitude to the management and the organizing committee who gave this opportunity for me. Thanks a lot.
Thank you, Dr. Prashant, for such a beautiful session. I don't think anyone has explained about the pandemic or COVID so beautifully and in so detail. So I'm really thankful to you, sir. And as we said, COVID pandemic, we can't tell it as a last pandemic, and we as a pharmacist should be always, prepared for it. And I'm also thankful for Dr. Prashant for coming from all the way from Amrita College of Pharmacy, Kochi, that within a very short period of time. And he immediately said okay when I have approached him. So thanks a lot, sir.
Thank you.
If anyone has any doubts or clarifications, please raise your hands. Thank you, sir,